Good morning and welcome to day 2 of the Safer Consumer Products Workshop on chemicals in hair straightening products. My name is Michelle Banks-Sardone and I am a public participation specialist with the Department of Toxic Substances Control. We are a part of the California Environmental Protection Agency. We will be referring to the Department of Toxic Substances Control as DTSC throughout the workshop. I'll be facilitating the workshop and encouraging you to provide us with feedback. We want to hear from you today. Next slide. By participating in the workshop, you understand the following. You've been entered in listening mode with the cameras and microphones turned off, but you will have the opportunity to actively participate with questions and comments throughout today. This meeting is being recorded and it will be posted to our website. If you would also like a copy of the PowerPoint presentation, it will be available for download as well. The link to our website has been provided in the chat. Next slide. Day 2 of our virtual workshop will consist of 4 panel discussions covering the following topics. Panel discussion number 1, the chemicals used in hair straightening products and discussion of alternatives. Discussion number 2, product information and categorical definitions pertinent to hair straightening products. Panel discussion number 3, hair straightening product use trends and exposure information. And lastly, panel discussion number 4, prioritization and evaluation of hair straightening and personal care products. Our primary goal is to hear from you today. So again, we are going to facilitate dialogue among experts in industry, academia, non-governmental organizations, as well as other government agencies. And we are seeking information on the use of potentially hazardous chemicals in hair straightening products, their function and prevalence in products, and safer alternatives under development or if they're already in use. Again, for your participation, next slide. Thank you. If you're joining us as a web attendee online, you can communicate and comment verbally just by raising your hand. So use the raise your hand feature at the bottom of your screen. When recognized, please state your name, state your affiliation as well, and unmute yourself and then begin your question and comment. You can also type your question into the Q&A. If you're joining us by telephone and wish to comment verbally, you can be added to the queue. Simply press *9. You'll be recognized. I will read the last 3 digits of your phone number. At that time, I will unmute you, and you can press *6, to unmute yourself. At that time, state your name, your affiliation, and then please continue with your comment. If you're joining us by phone and wish to submit a written comment, you can email us at any time at saferconsumerproducts@dtsc.ca.gov. As a reminder to everyone that's engaging with us today, please speak slowly and clearly so we can accurately record your comments. At this time, I would like to introduce the project manager for the hair straightening products team and senior environmental scientist at the Department of Toxic Substances Control, Christine Papagni, who will welcome you today. Christine.
Thank you all for attending today and being part of this conversation about hair straightening products and the chemicals they contain. I hope most of you were able to attend yesterday's session of this workshop. And if not, it will be recorded. It was recorded and it'll be uploaded to our website following the workshop, so you can check it out. And in addition to DTSC's presentations yesterday, we heard some phenomenal presentations from several outside speakers as well as hearing many insightful questions and comments, as well as some challenging questions and comments from attendees. And I was asked to provide a summary of yesterday, which is very challenging to do in 5 minutes. So I'm going to do what I'm going to call a flyby, and I apologize in advance to any of the presenters. I may miss some key points of your presentation, but I'm hoping I'll provide enough information that it'll encourage folks to check out the video of yesterday's workshop if they missed it. So our day opened with our director of DTSC, Dr. Meredith Williams, providing a welcome message as well as some of her own personal experience with hair straightening products. And then we had several presentations from staff at DTSC. I gave an overview of the SCP program and our 4-stage process to evaluate chemicals and products and how manufacturers evaluate for safer alternatives as part of that process. Michelle Banks-Ordone gave a great presentation on the social context of hair, including a discussion of how people of African descent in the US may feel the need to change their hair due to social or economic pressures. Dr. Michelle Romero-Fishback gave a presentation on some background of hair straightening products, in addition to discussing why DTSC is concerned and interested in evaluating them. Followed by a presentation by our Dr. Lynn Nakayama Wong, who is a staff toxicologist, and she discussed the 5 chemicals and 3 chemical classes that we evaluated in hair straightening products and some of their hazard traits and exposure information. And then with our outside speakers, our first speaker of the day was Jeanette Robinson Flint of Black Women for Wellness. And she gave a presentation talking about how African-American women and girls are overexposed and underprotected from chemicals and personal care products. And she also talked about some racial and health disparities. And she also talked briefly about the Taking Stock study, which is a study in Southern California where they examined racial and ethnic differences in personal care products used by women. And her presentation was followed by Robin Dotson of the Silent Spring Institute, she also talked briefly about the Taking Stock study, which was a collaborative study between Black Women for Wellness, Silent Spring Institute, and Occidental College, and some community organizers as well, or community participants. And Dr. Dodson also discussed endocrine disrupting chemicals that have been detected in hair straightening products. And in fact, this was the first study of its type to test hair products that are predominantly used by Black women. And this study not only detected 45 target compounds, 7 of those chemicals are chemicals regulated in California or banned in Europe. And her presentation was followed by Leslie M. Quiero-Salcala of Johns Hopkins University. And she discussed a pilot study she's been working on, which was the first study of its type to measure concentrations of select indoor air pollutants, including VOCs, volatile organic compounds, and particulate matter in hair salons. And these were salons that are primarily serving clientele who are African American or Latino. And the study also included a biomonitoring element. And not only were a number of VOCs or volatile organic compounds detected in salons, some of them exceeded occupational health guidelines. And there was also a correlation of high VOC concentrations in urine of the salon workers with select products, services, and work behaviors. And then we listened to and heard a great discussion by Alexandra White of the National Institute for Environmental Health, talking about the use of hair straighteners in relation to breast and ovarian cancer. And her study is part of a large-scale study, which is tracking 50,000 women across the US and Puerto Rico whose sisters have had breast cancer. And they've been tracking these women long-term. And that study, she talked about there being a higher risk of breast and ovarian cancer among women who reported frequent use of relaxers, straighteners, or pressing products. And our last presentation of the day was by Phyllis Clark of the Healthy Heritage Movement and Dede Tete of City of Hope. And they discussed their cost of beauty study, which discussed attitudes, beliefs, and hair product toxicity. And they essentially asked the question whether, beauty products are putting Black women at risk for breast cancer. And they also touched on several themes that were covered by the other presentations. So it was a great way to wrap up the day. And so for today, we're looking forward to continuing the conversation with everyone, not just with our panelists today, but also for all of you who are attending online. And we encourage you, as we talk about various topics with the panelists, to raise your hand, provide comments or questions through our Q&A feature. And with that, I'd like to turn it back over to our facilitator, Michelle Banks-Ordone.
Thank you so much, Christine. Next slide, please. As indicated today, we will have 4 panel discussions. We are about to engage in our first discussion, chemicals used in hair straightening products, and a discussion of alternatives. Today's discussion number 1 is going to be moderated by Christine Papagni, and our panelists throughout the day. I will introduce each one of them, let you know who will be sharing with us, and then I will ask that they give a brief, couple of minutes just about themselves to give you additional information. Our first panelist, Dr. Adana Yanos. She's an assistant professor at Rutgers University School of Public Health. Dr. Astrid Williams, an environmental justice manager with Black Women for Wellness. Dr. David Andrews, a senior scientist with the Environmental Working Group. Dr. Robin Dotson, research scientist with Silent Spring Institute. And Dr. Paula Johnson, the chief of the California Safe Cosmetics Program, and that is with California Department of Public Health. So Dr. Yanos, if you could tell us a little bit about yourself.
Sure. So I'm an assistant professor at Rutgers School of Public Health and the Cancer Institute of New Jersey. And I'm a cancer and molecular epidemiologist, and my work focuses primarily on understanding the causes of disparities, particularly in breast cancer. So a lot of the work that I have done has focused on understanding why do Black women, why do they tend to be diagnosed with breast cancer at younger ages, and why do they have more aggressive disease? Over the past about 5 years, I've become very much interested in personal care products, particularly hair products, and how they contribute to some of these disparities. We've published from the Women's Circle of Health study in 2017, data that suggested associations between hair dyes, specifically darker shades of hair dye, with increased breast cancer risk. We also observed some differences by race. We also examined associations with chemical relaxers and straightening products. And while we didn't find significant associations in the Women's Circle of Health study, we have continued our analysis with this data set, and we are seeing some interesting associations with duration of relaxer use with more aggressive tumor features. I've also started a more recent research endeavor which focuses more broadly on personal care product use and variations in use by sociodemographic factors. And we're still looking to see, how these various exposures in personal care product use contribute to disparities in breast cancer and other conditions that are hormone mediated. So thank you for the invitation to be here. Happy to contribute to the conversation.
Thank you so much, Dr. Yanos. At this time, Dr. Williams, could you tell us a little bit about yourself and your research?
Yes, good morning, everyone. My name is Dr. Astrid Williams. I'm the Environmental Justice and Reproductive Health Manager with Black Women for Wellness. We're located in Los Angeles, California. Some of the things that we're engaged with is our Behind the Chair campaign, where we have multiple healthy hair initiatives. In our presentation yesterday, you would have learned about, a few of those in regards to looking at personal care products and hair care specifically as it relates to our audience. Our audience is Black women and children, so we're very passionate about educating and advocating for their needs. Also, we are taking part of our Taking Stock study in partnership with Occidental College, and both Ms. Robson Flint and Ms. Robin Dotson, my voice is going out this morning, both shared on our Taking Stock study, where we looked at Black and Latino women and their personal care products, behavior, and exposures to that. And so those are some of the things that we deal with in addition to engaging with our audience on a one-on-one with Curls and Conversation, and our Behind the Chair initiatives to help protect salon workers and hairstylists. And so I'm very glad and happy to be here.
Thank you so much, Dr. Williams. Dr. Andrews, if you could tell us a little bit more about you.
Thank you, and thanks to Safer Consumer Products for looking into this product category. I'm David Andrews. I'm a senior scientist for Environmental Working Group. I have a chemistry PhD background, and I've been with Environmental Working Group for over a decade now, spending a lot of time working on our consumer products database. That's the Skin Deep database that we use to really highlight the ingredients used in cosmetic products and provide information to consumers about the ingredients in the products and what potential associated hazards there are with those ingredients. We've also done a lot of work focusing on ingredient labeling issues and pushing for more disclosure across the use of cosmetic products, in particular with respect to fragrance ingredients, as well as in other consumer product categories. Just recently, we also, along with salon workers and Women's Voices for the Earth, submitted a petition to the Food and Drug Administration requesting a ban on the use of formaldehyde in hair straighteners. This was a follow-up petition to one that I worked on in 2011 that requested the FDA investigate the use of formaldehyde in hair straightener products. And a report we also worked on a similar time in 2010, 2011. This is where I got interested from the chemistry perspective, just in terms of the false claims companies were making in terms of what ingredients they were using in their products, and really did an investigation of the formaldehyde-based keratin products, what products were available on the market, what we knew about those products, the chemistry of it, and also what the cosmetics industry was doing or not doing with respect to these ingredients, and frankly, what regulators were doing or not doing with respect to cosmetic products, and at least considering the potential health implications for the public and salon workers who were using and applying these products. So really, a lot of our work is focused on taking large databases of information, large collections of information, particularly with respect to cosmetics and cosmetic hazards, and making that available to a broader audience. And so a pleasure to be here today, and look forward to contributing to this conversation.
Thank you so much, Dr. Andrews. And now, if we could get a little bit more about you, Dr. Dodson.
Sure. Hi, my name is Robin Dotson. I'm a scientist with Silent Spring Institute. We are a nonprofit research organization located in Massachusetts, where we study the links between the environment and women's health, with a particular focus on breast cancer. And I am an exposure scientist by training, and have been with the Institute now for over 10 years, thinking about exposures to endocrine disrupting chemical compounds, EDCs. EDCs, we readily measure in our homes, so in air and dust, also in our bodies. So have conducted several biomonitoring studies and measured these in our bodies, and as well as product testing studies. So have done product testing on a wide range of products, household products, cleaning products, cosmetics, as well as a study that I shared yesterday on EDCs and hair products used by Black women. And we find EDCs are very common in many of the products that we use every day, and shared that yesterday. Between 4 and 30 EDCs of our targeted chemicals were detected in the hair products. I continue the work looking at documenting and studying consumer product use patterns, part of the Taking Stock project that Astrid had mentioned, where we are trying to document product use among women of color living in California. And we are excited because we just published a paper, our first paper out of that project, summarizing a survey that we did across California, looking at differences in product use, finding that Black women tended to use more in different types of hair products compared to other women, as well as more intimate products than other women. Whereas, for example, Latinas tend to use more cosmetics. And so that work is ongoing, and we hope to share more of that as it moves forward. And we are looking at some biomonitoring data for that, as well as some more intensive product use data. So hope to be able to share some of that in the future as it relates to hair products.
Thank you so much, Dr. Dodson. And Dr. Paula Johnson, if you could give us some additional information about your background.
Sure. Hi, everyone. I'm Paula Johnson. My background is in environmental health and epidemiology. And for the past 7 years, I've been with the California Safe Cosmetics program at the Department of Public Health. And our program is a public health right to know program unique to California. Unlike the Department of Toxic Substances Control, we don't regulate chemicals. We conduct investigations and collect information on chemicals in personal care products and make it available to the public. The Safe Cosmetics Act in California requires that cosmetics companies report to our program products with ingredients linked to cancer or reproductive or developmental harm. And in addition to that, in January, coming up, the Fragrance and Flavor Ingredient Right to Know Act in California will require reporting of fragrance and flavor cosmetic ingredients linked to an expanded list of health effects, more closely aligned with the Safer Consumer Products Program's candidate chemicals list. So we maintain a public searchable database where anyone can look up what's been reported by companies. And if I can, I'll drop that link into the chat for you all.
Thank you so much, Dr. Johnson. So at this time, I'd like to turn the meeting over to our moderator for panel discussion number 1, Christine Papagni. Christine?
Thanks, Michelle. So yesterday, we provided a presentation where we discussed the 5 chemicals and 3 chemical classes that we've already evaluated, at least in preliminary research in hair straightening products. And to remind people, they were sodium hydroxide, formaldehyde, diethanolamine or DEA, benzophenone 3, triclosan, cyclosaloxanes, parabens, and phthalates. And we're curious to know, are there other candidate chemicals or other chemicals of concern that you all think we should be doing research on and looking into? So I'm going to go ahead and start with Dr. Janos.
Hi. I think, that's a good starting point. One thing that I'll just mention from an epidemiologic standpoint, we haven't really dived into, the specific chemicals. But I will say a lot of the research that has examined the relationships between chemical straighteners and relaxers with various health outcomes haven't started to include the formaldehyde-based products, so the keratin products and those types of, I think those products, we really need to understand how they might be related to this.
Thank you, Dr. Janos. How about Dr. Williams?
To add on to what Dr. Yanos just stated, I think that we talked in great detail yesterday about the different classifications of the chemicals, particularly with the chemical straighteners and relaxers, the formaldehyde. I think this needs to bring greater awareness to that, that are in those products. We talked about endocrine disruptors, parabens and all of those that, disrupt our hormones. So just greater research surrounding those areas.
Thank you. And Dr. Dotson.
Thanks. Yeah. So, I think we've done some work on thinking about endocrine disruptors, which I think are very important, especially because that corresponds to the disparities that we're seeing in women of color who are using these products. But I do want to highlight, and I think formaldehyde is one of those examples, but some work that Leslie presented yesterday on VOCs. I think those we didn't target those in any of our testing. You kind of do different chemical methods to get those chemicals. And one that I had in particular noted that is really concerning just because given its health effects, but she found in one of her slides, she had showed the relationship between 1-bromopropane measured indoors and the use of hair relaxers. And that is, that chemical in particular, given its toxicity, it is a candidate chemical, I believe. So I think greater awareness around the VOCs, in addition to the ones that you've already focusing on, but greater awareness around the VOCs and that one in particular should get some more attention.
Great. Thank you, Dr. Dotson.
Mm-hmm.
All right, Paula, Dr. Johnson. I may start calling all of you by first name since I've had conversations with all of you. So
no problem, Christine.
Thank you.
So we're just focusing on hair straightening products. I'll talk about just it's easiest to start with talking about what's been reported into our database. I was looking at this a couple of days ago, and right now we have 22 hair straightening or relaxing products in our database. Not all of them are advertised as keratin straighteners, but they have some kind of relaxing claim. And we're seeing products that contain formaldehyde, like Brazilian blowout, but also cocamide diethanolamine, cocamide DEA, and coal tar. And so those are also reportable ingredients, and that's why they're in our database. And I don't have complete ingredient lists for all these products, but 2 products marketed as without lye or formaldehyde contain parabens, 2 or 3 different parabens in the products. I know you're focusing on hair straightening right now, and obviously formaldehyde is a big ingredient for those. But I just wanted to also mention that in our database, we have over 100 products with formaldehyde, and not only hair straighteners, but other products, including some other hair products such as hair volumizer, lotions, shampoos, and some others. And then the additional candidate chemicals in hair straightening products that we've seen are parabens and formaldehyde releasers, such as, for example, dimethyl and also a fragrance ingredient, Lilial.
Thank you, Paula. Appreciate it. David, are you still with us? Are there any additional chemicals that you think we should be doing research on?
Can I add one point that's in terms of this? It's kind of this question seems to be kind of a regulatory process question, and I think there's one place in the background documentation that would be really helpful would be expanding upon really the list of products and ingredients within those products. In some consideration, I mean, there's a reference, I believe it's in the Mintel database, which as far as I can tell is proprietary. So there's no way for the public salon workers to check whether or not the products they're using are being represented in this list of products that SVP used to prioritize. And so we know that, at least I think we know that the most concerning ingredients being used in the products to a certain extent, but I don't know that we're necessarily capturing the full extent of concerning ingredients being used in products, largely because this information isn't public. And I think it's also, there should be some process to evaluate whether or not the products in this database are representative of what's being used in salons. And I think it needs to be representative both in terms of what's being used by different racial and ethnic groups, especially because of some of the results that were even presented yesterday in terms of very different exposure profiles for different groups based on the products being used. And so I think it's just worth verifying that the products underline, the products and the ingredients underline some of the decisions in terms of what ingredients are being highlighted here are being representative of what people are being exposed to as much as possible. And some of this is not readily available information. I know our database and the Skin Deep database, we don't have very much in this space. largely because a lot of it are salon-based products. We are trying to become much more representative in terms of capturing some of the kit-based products, something that we didn't really have the database structure for originally. But I think that's my main point in terms of the ingredient scope is some greater information and transparency in terms of the products and how representative they are of what's actually being used would be very helpful.
Thanks, David. And you bring up a great point, because finding ingredient information continues to be challenging without necessarily going. You can go to the store and look at some ingredient labels, but at least with professional products, many still don't have ingredients. And you mentioned the Mintel database, which is a fee-for-service database that we have access to, but it primarily includes retail products. It does not include professional products. So that continues to be a data gap for us. We have some information obviously on ingredients in professional straightening products, but there's definitely some missing information there. And to follow up, are any of you aware of any degradants or contaminants in hair straightening products? For example, somebody did mention yesterday that cyclosaloxanes and other siloxanes can emit formaldehyde when heated, and we're aware of formaldehyde releasers. But we were curious, especially, I know, Robin, you've done some testing. Are there other compounds that aren't necessarily ingredients, but that are contaminants in these products that you might know about? Let's start with Robin Dotson, since I've already pointed you out.
Sure. I'm not aware. Certainly yesterday I talked about how many of the chemicals that we found were unlabeled. And so I think there's a little bit of discordance between what is actually on a product label. And that could just be because, their intentional ingredients are supposed to be labeled. And again, these are retail products, not professional products. But those could be because of sourcing materials that the manufacturers are aware of, or the packaging, things like that could be introduced. Although all the stuff all of the chemicals that we reported yesterday, that I shared yesterday, we did extensive QC. So I do not think that's an analytical method issue. It's more of it was contaminant in the product itself. And we were using the products bought off the shelf. So I'm not aware. It's kind of hard if you don't look, you don't know what you're missing type of thing. Although I did, to Paula's point earlier around this formaldehyde releasers, I think those in particular are, we should spend some time thinking about some of that formaldehyde chemistry, as we know that those can be created and produced as degradants. So,
all right, thank you, Robin. Paula?
Yeah, about the formaldehyde releasers, I think more research needs to try to figure out how much formaldehyde is in a product when they contain formaldehyde releasers. Sometimes I've seen one formaldehyde releaser, sometimes several in the same product. And but when formaldehyde is the active ingredient in a product, you usually know about what concentration it is because it's on the safety data sheet. But when it's a formaldehyde releaser, it's much more mysterious. I might have another thought that'll come back to me, but.
All right. Let us know.
Okay.
Thanks, Paula. How about David?
Sure. The term formaldehyde releaser, it's sometimes used for preservatives and sometimes used in terms of ingredients that are added to products that are releasing formaldehyde upon heating. And so I think of it, at least in this category, in terms of ingredients, potentially some of the aldehydes, or I believe it's glyoxylic acid, that have been added at least to some of the products advertising as formaldehyde free. That are potentially of interest for something that SCP would want to look into in terms of ingredients that are not specifically formaldehyde, but may be maybe functionally formaldehyde when used and heated, and as potentially of interest. And I think this came up. I know it was even an issue when or at least it came up in some of the research I did in 2010, where I believe it was a company in Australia provided their testing results for their formaldehyde-free formula that still had not quite, I believe is in the 0.2 to 0.3 part per million range for air levels for half an hour during treatment, with no formaldehyde in the product, and no formaldehyde as a specific ingredient, but where they're obviously measuring some formaldehyde during the treatment process. So I think that is definitely a place to look at in terms of, because of the heat and the thermal potential for thermal breakdown of some of these short chain or aldehyde type molecules, that you will have some potential contribution to inhalation exposure issues.
Great. Thank you, David. Adana, would you like to answer the question?
I actually don't have anything to add.
That's okay. And we knew at the beginning that not all the panelists are going to be able to answer all of the questions. So we just want to give you each an opportunity. Astrid?
Same as well.
Okay, not a problem. And I see that Paula Johnson has her hand up.
Yes. So what David was talking about reminded me about the thought that escaped me about heat releasing formaldehyde. And I've read some reports about cyclosaloxanes when heat applied can release formaldehyde as well. And then I also wanted to mention the other contaminants that actually have been reported to us, and those have been 1,4-dioxane and ethylene oxide.
Great, thank you, Paula. Appreciate that. So our next question is regarding safer alternatives, and any information each of you may know about some safer chemical alternatives that are either currently being used in hair straightening products or potentially could be used if they have the same functional use as some of the compounds that folks are concerned about. And let's start with Astrid.
So as alternative, there is the calcium hydroxide that are used in the Noy Relaxers, but I would just like to caution as well that it's still a chemical ingredient that can be irritant to skin. You can have abrasions. Just looking at the usage of it, as you do it at home versus professionally. Oftentimes, as we see in these kits, as it's stated on the box that it's the no lie, but still, as a consumer, they're not aware that these are still chemicals in it. So there still needs to be greater awareness about the use of these types of no lie relaxers.
And you actually brought up a good point, Astrid, because it's one of the questions that we have as sort of an add-on to this, because there are plenty of no lie relaxers that actually have lye. And we're sort of questioning, well, are some of those other compounds actually safer than sodium hydroxide? Because we know some of them are potentially even higher concentration.
Yes, and as a consumer, they're not chemists, right? And so they don't. Yeah, so therein lies the problem or the issue with that. So again, looking at more natural alternatives versus a chemical base. Yes.
Great, thank you, Astrid. And same question for Adana.
So I am not I can't really speak to what products or what chemicals would be safer alternatives, but I do think, to Dr. Williams' point, as far as consumers and, the communities that I share my research with and speak to, I think these are questions that they also have. If women decide not to chemically straighten their hair, or to use no lye versus lye, or to use these different products, they want to know which ones are safer alternatives that will also work, so I think that's a question that, is really worth answering.
Right. And that's, we're interested in knowing as well, especially when we are evaluating these. We'd like to know not just what chemicals in the product are safer, but what products are safer. So same question for Robin.
Sure. I mean, I don't have a specific chemical necessarily, but it's something that, Christine, I think we've talked about before is it doesn't always have to be a 1-for-1 substitution. I mean, I'm not a material engineer, but I'm wondering if, for example, like benzophenone 3 is even needed in these products. Presumably that's to protect the product itself from UV degradation. But I mean, I don't know. So I think it's more of an evaluation of not necessarily a 1-for-1 swap. You take out benzophenone 3 and put in a different UV filter. I think sometimes there's an evaluation of just whether or not those are all necessary for the performance that you want to achieve to straighten the hair.
Thank you, Robin. David?
Sure, and I don't have specific alternatives outside of what was identified in the documentation also, but I would reiterate the point that there's significant consumer interest in this in terms of, in particular, what are the risks of these different products in terms of hazard and there's always that trade-off in terms of functionality also, but significant consumer interest, and it's a lot of looking into this. I ended up in the patent literature, which is I mean, in some ways, ideally there would be some direct feedback from the manufacturers of some of these products or formulators specific to this product category, but I don't have that expertise.
Great. Thank you, David. And Paula?
Well, there are a lot of products on the market out there. Some are professional use only, and some are available to everyone. And, so there's potentially a lot for you guys to look into, because there are so many products. There's like hair relaxing creams, and it's not like a lye or a high pH, as far as I can tell, product. And I'm not sure what the active ingredient is that relaxes the hair or how well it works, but there's definitely a lot more to look into. I have seen like the no lye products contain other ingredients of concern, like 2 or 3 different parabens. And so it's just, substituting a different problem. Maybe it's not a direct chemical substitution for the lye, but it's a different type of product claiming the same sort of effect, but with different problem chemicals in it. So it's very difficult. And then a lot of the products are professional only, and sometimes I've seen them for sale on the internet, even, so anyone can buy them, I think, and they don't have the ingredients available online before you're making the purchase. Another thing just to bring up that, I know that for a substitution, it doesn't always have to be a chemical substitution. So it could be a process substitution. So one process substitution for chemical straightening is heat straightening, like a flat iron, which I know a lot of people use already.
And thank you for bringing up that point, because as you said, substitutions aren't always chemical. And so that was going to be my follow-up question. You helped lead right into it. What are some of the other alternatives to some of the products? And I know we're supposed to be mostly talking about chemicals, but in terms of alternatives, what are some of the other alternatives? And what are some of the alternatives, especially for sodium hydroxide and relaxers? Astrid already mentioned calcium hydroxide. And we're curious if there are what the other substitutes for that are. We have a list of some, but we're curious if you all have information on that. And rather than call you out on this one, I'm just going to let you raise your hand so I don't put you, because I know this is a specific type of question that some of you may or may not have any responses to. All right, I see no hands being raised. So it looks like none of you have suggestions on other alternatives to straightening products or substitutes for sodium hydroxide and relaxers. All right, that's okay. The final question on chemicals is about DEA and nitrosating agents. And one of our attendees actually asked the question on at yesterday's workshop, or day one of our workshop, actually, about the prevalence of nitrosating agents in personal care products, because with DEA and even cocamide DEA, the concern is often them becoming interacting with nitrosating agents and becoming more carcinogenic. And so we're curious, do any of you have any information on the prevalence of nitrosating agents in products? And I'll let you raise your hand, your Zoom hand for this. And if nobody raises their hand, we'll know that nobody has that kind of feedback. Paula.
I may not have the answer, but I just wanted to clarify that with DEA, you're speaking of diethanolamine?
Yes.
Right.
Thank you.
Well, I do know that, it's possible that, a common ingredient in hair products and maybe some other products is triethanolamine, which can degrade to diethanolamine, which is that's on the Prop 65, I believe, chemical. And so I don't know how often this is happening or how much contamination some of the products with triethanolamine, how much they're contaminated with diethanolamine, or what happens within the product matrix, but that's a potential to form diethanolamine and then the nitrosating agents.
Thank you, Paula. Sorry, I was on mute. Does anyone else have any feedback on this question about nitrosating agents in personal care products? If not, I'm going to pass over to Michelle Banks-Ardone, our facilitator.
Thank you so much, Christine. And thank you to all of our panelists as well. That was a very insightful conversation. I see that there's some questions that are still out there and open-ended. That is going to continue our discussion and our research. So at this time, we want to hear from you also. If you are joining us as an attendee, and go to the next slide, please. It's really that time for your active participation. You've heard some of the discussion and the questions that have been asked. Are there questions that you have that you would like to share with the panel as it relates to chemicals and alternatives? Are there some suggestions that you may have in terms of comments, research that you're doing? This is the opportunity for you to share with us right now. And if you have forgotten, I do want to remind everyone, if you would like to contribute verbally to the discussion, if you're joining us online, simply raise your hand in the reactions tool that's located at the bottom of your screen. You also have the opportunity to type in your question or comment in the Q&A. And if you're joining us by telephone, if you press *9, you can also be added to our queue to speak verbally. And if you press *6, you will be unmuted. I will also recognize you by calling the last 3 digits of your phone number so you know to press *6 and unmute. In either case, please state your name, your affiliation, and speak very clearly. So the floor is open for you. And it's okay if you don't have any questions right now. I want you to take out that pen and pad, write them down. We do have a few more discussions to go. And before we, we have one question that has now come into the Q&A. Thank you so much. The attendee is anonymous, but there is the question, are no-lie relaxers considered a safe or safer alternative? And if there's anyone on the panel that would like to address that question.
I would like to say that it just depends on what you're considering, as safe alternative for that. Still, calcium hydroxide was just commonly known as the no-lie relaxers. It's because it's less abrasive in terms of its pH, level on there, as an irritant to your skin and to your scalp, but it's still a chemical. So I would venture to say, looking at the use of it, the frequency, and also other, types of, thermal styling. But those are just some of my thoughts in terms of safe. So it's not going to have as a higher pH as with the sodium hydroxide. But if someone can share in terms of the chemistry of it, that can also lend some insight to that as well.
Thank you, Dr. Williams. Is there a panelist that has some insight on the chemistry? And while you think that over, we do have another question. And this one is coming to us from Jennifer Ortega. If there are chemical substitutes for certain ingredients that mimic the chemical structure to do a specific function in the hair, would that substitute also not have similar health effects since the chemical structure is still similar to the original? Dr. Dotson.
Yes, I think this question is very important, and I think something that needs to be considered. We see this kind of regrettable substitution happening all the time, where we just kind of swap out one part of the molecule to keep its functionality, but its toxicity remains the same, just simply by name. So, right, the classic example is BPA, and it's substitute BPS and BPF, not necessarily relevant to hair products necessarily, but I do think it's something to consider, and something that I'm hoping during this part of kind of, your program being able to do a real detailed kind of alternatives assessment would capture any of those potential substitutions to try to avoid that. So it's a great question, and it's something that needs to be considered. And I'm hopeful that your whole program is designed to try to capture that before it becomes a problem.
Thank you so much, Dr. Dodson. I believe Christine also would like to comment. Christine?
Yes, thank you, Michelle. Structurally similar chemicals are tricky, and they are part of our regulation allows for us to evaluate, especially if there's data gaps, to look at the hazard traits of structurally similar chemicals. But anyone who's a chemist or a toxicologist knows, even though they may be structurally similar, it doesn't necessarily mean they're both hazardous. So it's unfortunately, it's a chemical by chemical basis that we have to evaluate them.
Thank you, Christine. We have another question, and this one is from Kathleen Norling. There was mention of using essential oils as a safer substitute for some chemicals, in parentheses, fragrances. Could anyone comment on the research that these are so much safer? I have heard that some of these are dermal irritants, and certainly have heard of cases where essential oils have triggered an asthma attack. Christine? And
yes. Okay. In the presentation we gave, we didn't make any determination about the safety of any of the alternatives that we are aware of. We're just trying to present that we know there are alternatives. We've actually have not done any research yet on essential oils. So if anybody has any information on their safety or toxicity, we're interested in learning that. We simply did a little bit of research to see what potential alternatives are out there for some of the compounds that we evaluated, with no determination on their safety at all.
Okay, thank you, Christine. And also I see Dr. Johnson also has a comment.
Yeah, I think it's a very good question. And I do hear people referring to the use of essential oils as being safer, or all other kinds of natural substances. Unfortunately, even naturally occurring substances can be hazardous as well. For example, on the California Prop 65 chemicals list of hazardous chemicals, you'll see some of these ingredients or components of essential oils, such as beta-myrcene and methyl eugenol, pulegone, which is in peppermint oil. So I think that there's still a question of, there's still a safety question of comparing the whole essential oil to a component of the essential oil, like pulegone in peppermint oil, for example. And if you're using concentrated pulegone, is that more hazardous than peppermint oil as an ingredient? That's something I don't know, but I do know that those components of essential oils are, some of them are considered hazardous, and there's been some research showing links to cancer for some of those as well. So they're not necessarily safer. So unfortunately, like Christine said, it's a chemical by chemical basis.
Thank you, Dr. Johnson, and also Dr. Williams.
I'd just like to note from the lay community perspective is that they do have essential oils that are out there that are synthetic. And so just looking at the variation or the difference between your synthetic essential oils versus pure grade essential oils, I think as consumers, they may not notice the difference when you're looking at box retailers, discount stores where you can go into TJ Maxx or, Marshalls and things where they have that in there. And the synthetic essential oils can be, just as toxic. So looking at that, and any products, so to say, can, be a potential hazard in terms as an irritant. And so just knowing your own personal, level and exposure to that, and also just ventilation when using it. I don't have the specifics of the research surrounding it, but lavender is an essential oil, and there has been growing research around lavender, particularly as being, something of concern to look at. So just, again, with being a savvy consumer and looking at the products that you're using.
Thank you so much, Dr. Williams. We have another question. Oh, I'm sorry. Dr. Johnson, did you want to add something before we move on?
Yeah, I just thought this would be a good time to plug my program's database again, because speaking, the fragrance chemicals. So, starting in January, the fragrance and flavor chemicals are going to be required to be reported into our database if they are associated with adverse health effects, such as cancer and reproductive harm and so forth. So that hopefully will be a good source of more information on products that might not otherwise be out there and might not even be on the labels. And also the fragrance allergens, as the person who asked the question, fragrance allergens will be reportable to our database as well. Thanks.
Thank you so much, Dr. Johnson. And we do have a thank you here from Kathleen, who asked the question. Thank you so much, Kathleen. Our next question is from Claudio Sorrentino, and this is to all panelists. In an ideal world, how you think that it could avoid, okay, how do you think it could be avoided to introduce into commerce chemicals intended to be used as hair straighteners, which are either unsafe to use or for which there are no sufficient information about the safety of their use?
I'll try to address the question. If I'm understanding the question correctly, I mean, I think one way would be to have better regulation of products that go on the market, and chemicals that are allowed into consumer products. Without having more testing of these products to confirm their safety, we don't know, how every single chemical that is found in a chemical straightening product or a relaxer product might impact health. But I think that is what we want as consumers, and as scientists, really trying to understand how different exposures impact our health. We need to know what these chemicals actually are doing to our cells and our bodies. So more regulation, more testing.
Thank you so much, Dr. Yanos. And I see that Dr. Andrews also would like to address the question.
Sure. This really gets to the importance of both the alternatives analysis, transparency in terms of ingredient labeling, and actually knowing what's on the product so that both the public as well as scientists and researchers and regulators can evaluate what ingredients are in products. And I will reiterate also the need for federal regulations to address this on a holistic scale. It gets outside the scope of SCP, but really important in terms of having an authority that can ensure that ingredients are tested for safety and that unsafe ingredients can be removed from products.
And I see that Dr. Dotson also has her hand raised. Dr. Dotson?
Sure. I mean, I think you've already kind of hit on this, but I think, right, it's this idea is like it's an upstream problem, and it's a chemical regulation problem. But I would suggest that perhaps there are some models out there that we could look towards. I mean, this is not an STP kind of task necessarily, but the European Union has done a much better job of thinking about chemicals and evaluating them for safety prior to their use, shifting the onus from a consumer standing in the aisle of CVS to a chemist actually manufacturing the product, the chemical in the product itself. So I think it's moving upstream and doing the sufficient vetting before they are even on the shelves for consumers. Because I do hear, we hear a lot in I think a lot of these conversations around products use generally kind of shift towards like what the consumer do, how do they make decisions? But I don't think we need to put the onus completely on the consumer. And that's why SCP is here. And that's we need to kind of move upstream and tackle some of those issues. So the consumer, as was mentioned, I think Astrid said this, right, doesn't need a chemistry degree to figure out which product to buy.
Excellent point. Thank you, Dr. Dodson. Don't currently see any questions at this time. And we have approximately, we have a hand raised. So I am going to unmute you, and that is Janet Nudeman. Janet, if you could please be sure again, state your name and also your affiliation.
Let's see. Can you hear me okay?
Yes, we can.
Oh, okay. All right. Thanks. I'm just in a parking lot driving to work, and so I wasn't sure about my phone's technology. So I just wanted to say I am so thrilled by this 2-day workshop, and I have just been like literally at the edge of my chair, listening to all of the wonderful speakers. So I want to thank all of you for what you've contributed so far. I have a couple of quick comments. One is regarding the question, or someone made the comment about evaluating the safety of botanicals. And Paula and I and others have really been struggling with this question. And I want to let folks know that Chem Forward, which is this new organization that's emerging, is creating a repository of hazard assessments of chemicals in both beauty and personal care and other consumer products. And they're starting to try to fill some data gaps for botanicals. So they're going to have some really interesting information, and people should know that they exist. And just be aware of that. And I also wanted to put a plug in for Paula's Safe Cosmetics Program database, who will soon have parsed information for both professional salon products and retail consumer products, retail cosmetic products, again, having to do with toxic fragrance and flavor ingredients in those products. So people should keep an eye out for that, particularly as it relates to salon products, because there's been a lot of discussion in that regard. And then lastly, I just want everyone to know about a project that our Campaign for Safe Cosmetics is working on with many of the people that have been speaking today and yesterday. We're creating a list of safer Black beauty products in a very, very, very comprehensive way, scraping the data from 300 Black beauty brands, Black-owned beauty brands that we've been collecting for the last 6 months. We're scraping the ingredient data, and then we're going to compare the ingredients in those products to the Cleria database, and a list of chemicals of concern that we know are present in Black beauty and personal care products. And that project will create not only a list of safer Black beauty brands for consumers, but also a list of ingredients that we're planning to turn into a do not use restricted substances list to guide safer purchases for retailers and guide safer reformulations for Black beauty companies themselves. So that's a lot of information. I just want to say, if folks are interested in learning more, they should reach out to me at janet@bcpp.org.
Thank you so much, Janet. That was just great information for sharing with us. And thank you so much for joining us over the past 2 days as well. We're glad to hear that this has been incredibly helpful and that it is keeping you engaged. At this time, we have actually reached our end of this particular panel discussion. So to do our transition into our next panel discussion, we are going to have a very quick 5-minute break. And at that time, we are going to come back with our panel discussion number 2. And that is going to emphasize product information and categorical definitions that are pertinent to hair straightening products. So again, a very quick 5-minute break. It is 10:10, and we'll see you at 10:15. Thank you so much. Again, it is now 10:15, and we are starting with our second panel discussion. Welcome back to you, all of our guests, and also to all of our panelists. Our second panel discussion is product information and categorical definitions pertinent to hair straightening products. And this discussion is going to be moderated by our very own Armin Etman. And Armin is a DTSC hazardous substances engineer working as part of this project team. Armin, I'm going to turn it over to you now.
Thank you, Michelle. It's my pleasure to be introducing the second topic for discussion today, which centers around the theme of product information and categorical definitions pertinent to hair straightening products. So using the best data and information sources we have available, we can craft accurate definitions and terms, not only to help ensure that we're communicating effectively with our audience with scientifically valid information, but also it'll help us inform decisions when it comes to the scope of the products we eventually evaluate and prioritize, which will be discussed in panel discussion number 4. Some of the common terms with working definitions that we've mentioned so far in previous presentations and in our background documents are listed in the blue figure on this slide, such as hair relaxers, keratin hair straightening products, Japanese straightening or thermal reconditioning, and temporary hair straighteners. And on the next slide, we have several of these definitions listed in further detail as well that I'll read out. So some of our definitions I'll go ahead and read out. A hair straightening product is a broad term used when referring to all products which strengthen curly or heavily coiled hair. This term includes temporary and permanent products. Temporary hair straighteners are products that are used to soften or loosen curls temporarily. The straightening effect may last until the hair is wet or damp. And lastly, permanent hair straighteners are products that contain chemicals to break, rearrange, or set the disulfide bonds of keratin proteins in hair. The straightening effect may last a few months, even when the hair gets wet. So with that, I'd like to pose a first set of questions to our panel now. First of which is, do you have any recommendations for definitions of hair straightening products? And how can we refine our current product definitions? In the way that they're proposed right now, are they too narrow or too broad, or do they cover the product categories accurately? So I'd like to start first with Dr. Johnson.
I don't think I have anything to add to this at this time.
No worries. We'll definitely make our way back to you later in the discussion. Dr. Dotson, do you have recommendations for our definitions that we currently have listed?
Yeah, I'm not sure I have like the answer to this. I think this is something that I know, for example, in the Taking Stock project, we spent a lot of time kind of thinking about how to ask that question about whether or not women use these types of products. And we landed on, do you use, let me just make sure that I have it exactly right. So do you use hair perm, relaxer, or chemical straightener? And so we thought of it kind of more broadly. I do think that some of the feedback we were getting, at least from some of our community partners when we were asking the question, is that that perms can be, like, use of the term perm can sometimes be applied here, whereas, you know, in some cases you might typically traditionally think of a perm as actually curling the hair, but that a perm could be used to straighten the hair. So I think there might just be other terminology that it would be important to think about, perhaps what, you know, community members are actually using to refer to these products.
Thank you, Dr. Dodson. Dr. Andrews, what are your thoughts on our proposed product definitions?
Sure, I have 2 comments, and one is, I think, alignment with the studies that are available is important in terms of connecting for priority products, connecting those to the adverse harm and health impacts that have been documented in studies to date. And traditionally, those studies, as was just mentioned, look at this broadly. And as written, it's unclear to me if this includes all of the products bundled with hair straightening kits. And it's discussed somewhat in the background document, but it's unclear from this definition here if those are included. And I think this definition should be clear in terms of including all the products that are used and associated with the hair straightening product. So just clarity there in terms of encompassing those, especially those bundled products, as many of these are sold as kits, especially in the home use space.
Thank you, Dr. Andrews. And definitely combination products are something that we have considered and we're working to craft. So there'll be an opportunity as well to chime in on that as we move through this discussion. Dr. Williams.
No, I think this is pretty comprehensive. I don't have much to add to it. I would just like to note that, I mean, anything that you're using to disrupt your normal hair pattern or hair curl or texture is going to be, you know, considered a straightening agent. But going back to Dr. Dodson's point about looking at the term that, or the terminology that surrounds that, I just think sometimes it needs to be culturally appropriate, right? Within certain communities, like within African American, we're using more relaxers, versus in Latina and Hispanic populations, they're using more of the keratin, treatments in terms of straighteners. So in terms of, outreach and, dealing with certain populations, just being relevant to, the terminology that's surrounding that so that they can be aware.
Absolutely. Thank you, Dr. Williams. And Dr. Janos, your thoughts on our draft product definitions?
Yeah, so I think these definitions are pretty clear and also broad, but I wondered about texturizing products, since that is another, it's another type of chemical product that people use to change their natural curl patterns. And the other thing is about, pressing and using heat to change the natural curl pattern typically involves using some types of chemicals, whether it's serums or creams or whatever, to go with the heat. So how do you classify those products and where would they fit in here? I mean, because I don't necessarily view those as straightening products per se, but since they're involved in the straightening process, they probably should be considered.
Thank you, Dr. Yanos. That's actually an excellent segue into the next question that I wanted to pose the panel to chime in on, and what Dr. Andrews alluded to as well. It's in regards to what product types or what combinations should we consider, and in particular, we're curious to know what information sources there are out there that could help us identify these product combinations so that we can expand our scope and ensure that we're being inclusive when it comes to making sure that we get all the definitions succinct and accurate as possible. So for this question, I'm going to let the panel chime in as per expertise first, and then move towards calling on everyone one by one. So I'll start with Dr. Andrews. In terms of the kits, are there any other product categories or combination products that you're aware of that we should be looking at?
I don't. At least in terms of the relaxer-based products, those are typically sold in kits. As I said, I think this should encompass the use of all those products within the kit in terms of the hair treatment space. And I also want to make one comment going back to the previous question in terms of, I think it was an important point that Dr. Williams brought up in terms of these products being, these are products that are designed to change the structure of the hair and not necessarily always straighten. And so, I don't know how that's best encompassed in there. I was actually looking at the oldest patent I could find for formaldehyde-based hair treatments, where it's actually written as a product that would take naturally curly hair and make it straight, or take naturally straight hair and make it curly, with the end result just being a change in the structure as opposed to just a straightening.
Thank you, Dr. Andrews. Dr. Williams, since your answer was referenced, do you have any information on other products that are used in combination with hair straighteners?
So if you want to look at the kit, normally, what do you have? You have the primary product, which is the relaxer. Then you'll have a neutralizer and a shampoo or a leave-in conditioner. So I think it's appropriate to look at those, ancillary, products that are in there, like the shampoo. Does it have parabens in there? The leave-in conditioners, do they have other, endocrine disruptors or mimicking, endocrine disruptors in there? So looking, I guess, as a whole, the kit and the individual products. I know primarily we're focused on the relaxer portion of that, but also, looking at the additional items that are contained in the kit as well.
Thank you so much, Dr. Williams. And once again, I want to ask the panel, does anyone know of any information sources that would have more succinct information related to these product types and categories or working definitions that could help us craft these? If so, please feel free to chime in on that question. Yes, we'll start with Dr. Dodson.
Sure. I actually just wanted to call attention to, I think Dede put a question, a comment or a question in the Q&A that I think is relevant to here, and it's a really good one, is actually engaging with stylists or salon workers around the definition. I think it goes back to that same idea of talking to community members about how they refer to it, and it's depending on the community, right? How they refer to these products specifically. Like Leslie yesterday, I think she called them pressing products, was included in their definition. So just kind of thinking about how is it typically referred to in the community, and reflecting that terminology. And then just one quick point to Astrid's point about the different components of the kit. In the Helm et al. 2018 paper, we looked at the different components and actually did see differences in different components of the kits contain different chemicals of concern, where the cyclosaloxanes would be in a different part of the kit component compared to like the parabens or the phthalates. So thinking of that in total, since you use all of those components, is important, and not excluding, say, the shampoo and conditioner, since that is a part of the entire kit.
Thank you, Dr. Dodson. I see Dr. Johnson as well like to chime in.
Could I interject real quick, please, Armin?
Yes, please, Christine.
Thank you. In answer to Dr. Tete's question, with our draft product definitions, we haven't engaged stylists and salon owners yet about those definitions, but we do intend to.
Thank you, Christine, for answering Dr. Tete's question. Dr. Johnson.
I'm going to agree with what David brought up, Dr. Andrews, about the first definition in particular that you had up, when it was, if referred to altering the structure of, I think it said curly or heavily coiled. I'm just thinking back to the case of, in particularly Brazilian blowout, that was marketed to any type of hair that that wanted to be that you wanted to make perfectly straight. So even like mildly wavy hair, they were just marketing it to anyone to kind of achieve this, this ideal that your hair would be so perfectly straight and not bendable, and then you can go to bed and wake up with your hair perfectly straight. So I guess just to keep that in mind too. And then as far as some other products that might be related to hair straighteners, products that we have in our database, there are things like there's a shampoo called Straighten Up Shampoo, and I'm not sure of what the active ingredient is to do the straightening that they're claiming, but there's some claims of straightening, and there's other products that I might not have considered a hair straightener, but they've been reported in our database under the category of hair straighteners. And there's things like hair straightener creams that are leave-in hair conditioners, but the name is hair straightener cream. There's straightening smoothing gloss, and straightening gels, conditioning relaxers, bodifying relaxer, and relaxer neutralizing shampoos, and relaxing fluid. And, I'm happy to follow up and just send you the list of what's in our database too.
Thank you so much, Dr. Johnson. Dr. Yanos, would you like to chime in as well?
Yes, so Dr. Johnson's response just made me think of something else. Is it possible to put the screen up where you have the definitions? I just wanted to know if any of the products that are supposed to address frizz are also considered, because I think for some people, maybe they don't necessarily want to relax their hair, but they want to eliminate frizz. And I think that might be something that we should think about in the straightening piece. Just based on what Dr. Johnson just mentioned, some of these things are like serums and glossifiers or whatever it is. But the point is, it's to make the hair smoother, appear straighter. So maybe those are also classes of products that should be considered in the definition, so that we're not missing certain products.
Thank you, Dr. Yanos. And once again, the draft product definitions are up if anyone else would like to chime in on those. And as well, Dr. Johnson raised a great point regarding that there's other types of straightening products out there, and even aftercare products. If anyone else on the panel knows any other ones we should evaluate and include in our definitions, hair protectants, hair repair products, or anything related to those, we'd be happy to hear about those as well. So I'll give this one a free-for-all and see if anyone else has any information they'd like to share regarding aftercare products, hair products, or anything else used in combination. If not, I'd be happy to see what the audience has in terms of questions and comments related to this discussion, and I'll turn that over to Michelle Banks-Ordon to facilitate.
Thank you so much, Armin. Thank you also to our panelists. This is a great discussion. So to our audience, this is again another opportunity for you to actively participate with us. We are discussing information in relation to products, those definitions, but in addition to that, there has been the discussion about other products that go by different names, whether they're freeze agents to deal with, anti-frizzing, et cetera. So if you have questions, if you have additional data, if you have additional information in relation to that, this is an opportunity for you. If you're joining us online, again, you can raise your hand. You will be acknowledged to join us verbally and state your question or comment. You also have the opportunity to type it into the Q&A. If you're joining us by telephone, it is a simple *9 on your phone. Your hand will appear. We can recognize you. And once the last 3 digits of your number have been called, you can then press *6 to unmute yourself. So it's a very simple process in terms of joining us with discussion today. And if you have any questions or comments that may have come up during our last panel discussion and you neglected to ask us at that time, you'd like to do so now, this is an opportunity for you as well. And we will give it a few moments. And while we're doing that, I do want to thank Dr. Dede Tete. You did hear some of our panelists mention a question that she had typed into the Q&A. I believe all of you now have the opportunity to see that. It gave us a great discussion as it related to Have we had these conversations with stakeholders, those individuals that are going to use the terminology, hairstylists, those that use the product, to ensure that these definitions are touching bases? And that is something that we will continue to do as we do our work. You did hear from our project manager, Christine Papagni, and that we haven't done that specific outreach. And that is something that we'll continue to do as we continue our research. I believe I did see another comment that did pop up, and this is just for clarifying purposes. The anti-frizz serums, et cetera, are included in our definition of temporary hair straightening products. So we do want to provide that clarification. We did look at those, and they are considered under our temporary hair straightening products definition.
And
yes, Christine.
Michelle, I think we have an echo.
Thank you.
You may need to mute.
Okay.
So to further expand on that comment, we've just created draft definitions for now. And if it was unclear that anti-frizz or other type of those types of products fall within our temporary definition, we will consider clarifying it and maybe even including like specific terminology of which type of terms are covered under temporary hair straightener.
Thank you so much, Christine. We do have another question here in the Q&A, and that is coming from Latasha Russell. In regards to siloxanes, are regulations being considered in the maintenance products, like leave-in conditioners and styling products?
I'll take that question.
Thank you, Christine.
Right now, we're still in the decision-making phase, and we are taking that into consideration. So we haven't decided yet entirely which products or which chemicals, but we have looked at cyclosaloxanes in products in the straightening products and some of the products that are in the kits. And we have also considered potentially expanding, but we have made no decisions about that at this time. So we appreciate any input that anyone would like to provide in that regard. That'll help us in our decision-making process.
Thank you, Christine. Okay, so this discussion, this panel discussion, we did have a number of questions here. The panelists have engaged with us. You all as well, I do want to make sure if you have additional questions, and particularly those on the telephone, we did have Janet Noodleman join us earlier today. I want to make sure that you all have ease of access to us as well. Again, that is *9 if you want to raise your hand. And if I call those last 3 digits, sometimes your name actually does show, just to let you know. We will call you out and you can press *6 and you can unmute yourself. At this time, because we do not have any additional questions and or comments for our panel discussion number 2, we have 2 additional panel discussions, 3 and 4 we anticipated having after a longer break. So what we're going to do at this time, we are going to
Michelle. We have another comment.
Okay, thank you. This comment comes from Karen DeBazio. You might consider using the term hair curl pattern modifiers. Again, that's hair curl pattern modifiers to cover all aspects of altering an individual's hair pattern. Great comment. Thank you, Karen. As any discussion from the panelists regarding the suggestion? I'm going to take your silence as good suggestion.
Thank you, Karen, for the comment. I think hair curl pattern modifiers definitely covers the aspects that you mentioned. So it's something that we're going to take into consideration as we continue crafting these working definitions and move on to the next phase of our research.
Thank you, Armin, and thank you to Karen. I do know it takes a few moments to type into the Q&A, so I do want to wait a few moments for that, and thank you for bringing that to my attention. So we will wait a few moments to make sure that our attendees have an opportunity again to participate, and feel free to type into the Q&A as well. Okay. We do not have any questions. And I just want to make sure that we're not receiving any emails as well at our Safer Consumer Products email. So if those behind the scenes could let me know, I just want to make sure we don't miss out on those that might be sending us emails as well. At this time, not having additional questions, we had planned at 11 o'clock to take a 15-minute break. It is now 10:45. So we're going to extend that break somewhat. We may have a lot more questions for the last two discussions. So instead of a full 30-minute break, we're going to go ahead and take a 20-minute break for everyone right now. Again, that's 20 minutes. So we'll see you back here at 11:05, everyone.
Michelle, we have another question.
Thank you. Okay. Our next question is from Laura Gillian. How are you prioritizing chemicals for regulation? Will a future phase include risk characterization of each of the chemicals of concern? Again, that's how are you prioritizing chemicals for regulation? And will a phase include a risk characterization of each of the chemicals of concern? And we do have a response, and this is going to come from our CPAT supervisor, and that's Andre Algazi.
Thank you, Michelle. Here my voice echoing back here. Let me figure out what's going on. As Christine talked about yesterday during her introduction to our process, we use, it's a narrative standard, so we don't strictly make the prioritization based on risk. We would look also at other factors such as maybe how prevalent the product is in the market. So we might prioritize a chemical where where if you were just quantifying the risk for an individual using the product, it might be higher or lower than another product we might choose, because we would also consider sort of narrative factors as well. So we will be sort of qualitatively evaluating the risk and the impact. We want to choose things, that align with our priorities, one of which is protecting environmental justice communities and things like that. So it's not strictly just a risk calculation.
Thank you so much, Andre. And again, we're going to wait a few more moments for any questions that come into the Q&A. I believe every time I hint towards a break, we get another question that comes in the Q&A. So I am going to wait here patiently to ensure again that we get your input and feedback. And again, if you are with us by telephone, please do press *9 on your phone so you too can participate actively with us at this time. Okay, so I'm going to do another try at this. Let's see if we get another question in the Q&A. I'm watching you attendees here. Okay, so it is now approximately 10:50. And again, we had anticipated coming back at 11:15 for our next break. So we're going to come back, everyone, at 11:10. Again, that's 11:10. So we're going to go ahead and take a break. I'm looking at the Q&A just to see. Okay, so we're going to go ahead and take a break. It's a little longer than 15 minutes, but we'll be back at 11:10. See you soon. Excellent. Thank you so much. Again, welcome back. And want to thank our panelists for our first two panel discussions thus far. I also want to thank our last moderator, Armin Etzmat. Well done. I thank all of you for continuing to participate with us and your participation in the questions and comments. For these last two sessions, we certainly want to continue hearing from you. So let's don't wait any longer. We're going to continue with that third panel discussion, hair straightening product use trends and exposure information. Again, our panelists that are joining us is Dr. Yanos, Dr. Williams, Dr. Andrews, Dr. Dotson, and Dr. Johnson. And our moderator for this discussion is Christine Papagni. Christine, I'm going to turn it over to you.
Great. Thank you, Michelle. And thank you, everybody, for rejoining us. Our first questions are about frequency of use of hair straightening products. We're curious to know, like, in salons or at home, how frequently are certain products used, or if you can point us to some sources of information for both temporary and permanent hair straighteners. For example, I used to straighten my hair with temporary hair straighteners when I was young every day, but we're curious to know what the averages are. So I'm going to start with Dr. Dodson.
Hi, thank you. Yeah, so we looked at this question in our recent Taking Stock survey paper that was just published back in May. And we asked women, I think I phrased it earlier, was, do you currently use or have you in the last year used chemical perms, relaxers, or straightening products? And we looked at that in two different ways. I'll kind of give some kind of prevalence numbers in different ways. So in our analysis where we focused on women that were 18 to 34 years old, overall 7% of women, of the 357 women who replied, responded using one of those products currently or in the last year. If we look at a broader subset of, so that 7% of women overall, although that was 14% of Black women and 16% of Asian women reported that. If we look at it more broadly and look at women all from 18 to 54, those numbers are pretty similar for Black women. I think it was 13% for Black women aged 18 to 54 and 19% for Asian women. And I think these numbers are lower than previous studies, but that is kind of fairly consistent with what is kind of understood to be the kind of less use in more recent times. We also looked at it by age. So 18 to 25, 25 to 34, 35 to 45, and 45 and up to 54, and found that actually the age range with the highest use at just under, again, this is across all women, is just about 9% of women in the 35 to 44 years of age. That was the highest use category or age category. And I think that corresponds, our kind of hypothesis is that corresponds to kind of professional use to maintain hair for professional use. So those are the current numbers. Those data were collected up until right before the pandemic. So from January 2019 all the way up until March 2020. So fairly new, and those are California women.
Great, thank you. Mm-hmm. And Dr. Williams.
In terms of the trends, I think that more people are using at-home treatments, right, than going in professionally because of, pandemic or post-pandemic. So looking at some of the products that are, available on the consumer or retail base would definitely be a trend. Also, with that, I know we're focusing on the chemical straighteners, but there has been a growing trend to more of the natural hairstyles. And then, as Robin just reported, some of the numbers across the ages in relation to Black women, you can see the trends there as well. I think off the top of my memory, it was the 34, I want to say the 55 range, Robin helped me out, that we're using, hair relaxers more so. And versus the highest category, which would be 55 and above. And then the second category was the younger group, 18 to 24, I believe. So, which is interesting, right? Because you think that the younger population would be utilizing more natural hairstyles. So those are some of the trends that came up or that we were noticing within the Taking Stock study.
Great, thank you, Astrid. And Dr. Janos?
So we have data from the Women's Circle of Health study, and I can just give you sort of the proportions of Black women that reported regularly using chemical relaxers. And I can also provide some information about whether they used home kits or salon. So I'll focus on Black women that did not have breast cancer so that we just have a better, I guess, I get a better sense of the general population. And in that study of about 2,000 Black women without breast cancer, 88% of them reported regularly using chemical relaxers. This study sample is a wide range of age, ranging from age 20 to 75, and the average age is about 53. And interestingly, we saw that about 58% of the participants reported using chemical relaxers for 20 years or more. And we also found that about 17% of them reported using relaxers before age 12. So there is a pretty large number of women that started using relaxers, you know, what we're assuming is before puberty. What else do we have? We asked a few other questions. You know, we tried to look at the frequency of use in different age categories. So I mentioned about 17% used relaxers at ages younger than 12, and the majority of them reported using relaxers more than twice per year. We couldn't really get very granular in just how frequent they were relaxing their hair during that time frame. But that is a question that we're really interested in. In terms of typical application of relaxers, about 30% reported using home kits, while 18% reported predominantly getting their hair relaxed in a salon. There were also a group of women, about 40%, that reported using both salon and home kit. And in our recent analysis, we actually think that individuals that report using both might have higher intensity of exposure, because we're thinking, you know, if this is just a hypothesis that we definitely need to study a little bit more. But the idea is that if women are going to a salon to get their hair relaxed, that salon, you know, that stylist might not be willing to relax their hair again before 8 weeks or however long it's recommended. So if that woman wants to relax their hair sooner, maybe that's why they also have home kit. You know, that's why they're reporting both salon and home kit. So that is, you know, one hypothesis that we're studying. And we also looked at the history of both chemical relaxer use and hair dye, you know, regularly in Black women. And we found that about 30% reported both. In a newer study that we're doing, which is not focused just on Black women, we're seeing that relaxer use is decreasing quite a bit, which is what I think Dr. Dotson and Dr. Williams mentioned from the Taking Stock study. So there is sort of a push towards the natural hair movement, you know, or using alternate methods to straighten the hair rather than relaxers. So yeah, I think there is an indication that Black women are using relaxers less often, but there are still, you know, women that are using those products.
Great, thank you. All right, same question for David. Do you have any information on product frequency?
I don't have information. I don't have information specific to product or use frequency, but I would ask SCP to consider the availability of products, and especially the availability of salon use products from online retailers and other sources where that availability has significantly increased over the past decade in terms of your ability to pretty much get any salon use product if you really want to, which opens up different potential exposure concerns and risks, especially in a home use situation without ventilation.
Great. Thank you for that comment, David. And Paula.
Yeah, so I haven't talked about this yet on this call, but my program is currently part of a collaboration studying chemicals in personal care products used by Black, Latina, and Asian women. It's called the Capable Study. Phyllis Clark of Healthy Heritage Movement, who presented yesterday, is also part of this collaboration. And as part of the project, we surveyed about 300 women. And this is not published yet. It's under review currently, but I can share that what we found, hold on a second. So out of the women that we surveyed, we asked a question about permanent hair relaxer use. And there were the highest among the racial ethnic groups. It was highest for Black women who used the permanent hair relaxer. 22% of them used it at least once per year. And we decided to present that as a category of at least once per year because our community partners were actually surprised that the use wasn't higher among the people that we surveyed. But anyhow, the highest was 22% for Black women, and that's hair product, permanent hair relaxer use. Higher levels of, higher percentages of women used heat protector products. And then for salon hair services, so the 22% of Black women using the permanent hair relaxer, that was home products, and 17.8, almost 18% used hair relaxers in a salon service at least once per year.
Great. Thank you, Paula.
Mm-hmm.
And we had a follow-up question for Dr. Janos, and I believe Dr. Janos may have already answered it in writing. And the question has now disappeared. I can't find it.
I can read it and respond to it if you'd like.
Thank you, Dr. Yanos.
So Jennifer Ortega asked, what is categorized as regular use in your study? How often is regular? So in the Women's Circle of Health study, it was a questionnaire, and women were asked to tell us whether they'd used chemical relaxers for at least a year. So of course there are limitations with that question, but when we look at the responses, this typically meant greater than or equal, so 2 or more times per year. And there were some participants that reported substantially more than 2 times per year of relaxer use.
Great, thank you for that. And in addition to your studies, I know several of you have been involved in essentially personal care products surveys with different communities. Are you aware of other surveys that we should be aware of? Or other groups who are looking into personal care products, especially hair straightening products? I'll start with Robin.
Well, certainly there are numbers from what Alexandra White shared yesterday about the sister study. They have some information about use. Tamara James Todd has asked these questions in her cohort studies as well, although more recently I think has been focusing less on the straighteners and more of the kind of more temporary or maintenance products. But she's another researcher who I know of has looked at this. I also believe they looked at this in the SELF project. It's out of Michigan. Sorry, I can get you the reference for that. So, and all of them, though, it's interesting. I think we all kind of asked the question slightly differently, just as Dr. Yanos had just kind of said. And so trying to find kind of consistent responses over years is going to be a little bit difficult. But.
Great, thank you, Robin. And Astrid, do you know of any additional studies that haven't been mentioned yet?
No, I haven't.
Okay, thank you. And same question for Adana?
Yeah, so one study, and I can share the references with you, is the Black Women's Health Study. They've reported on relaxer use with a few different outcomes. And I just wanted to just reiterate what Dr. Dotson just said. You know, a lot of these studies, a lot of cohort studies and case control studies have looked at this question, and the question is asked differently. So one of the things that we really need to do in the epidemiology literature, especially, is to really have more consistent assessment of the exposure so that we can really understand, you know, whether it's just ever use or frequency of use, duration of use. And these are some of the questions many of us are working towards answering.
Thank you for that response. Paula?
I don't have any additional studies to add.
Okay, and David?
Nothing beyond what's been mentioned.
Okay, thank you. And to follow up with another frequency question, and we do plan on following up with salon owners and stylists, but we're curious to know how frequently, if you have any information on how frequently these products are used in salons, and even specified by the different types, either the keratin straighteners or relaxers, or even the Japanese thermal treatments. And I'll start with David.
Maybe you could come back to me. I don't know anything specific. Yeah.
It's okay. And even if you don't know the answer, if you have any resources you could point us to, that could be part of your answer if you know. And if you don't, that's okay. Paula?
Just what I've already commented on, that in our study, there's a slightly higher percentage of women using products at home versus in the salon. And then just, I'll mention too that a higher percentage of all the women that took our survey used hair color and hair and heat protecting products more often than hair relaxers.
Thank you, Paula. And Robin, I see that you put a comment in the chat.
Yep, just directing you to it's a 2020 paper on the self-study, on the self-cohort that I was mentioning. I'm not aware of the any salon. I don't do a lot of salon work, although I do wonder if Dr. Yesterday, I think Leslie, right? She talked about it. I wonder if she has some data.
And she is, I believe, listening in. So not just to Dr. Quiroz Alcala, but to anyone who's in attendance today. If you have any information on any of our questions that you'd like to share with us, please chime in through the Q&A or raise your hand. So I'm going to pose the same question to Astrid.
And so you're looking at the frequency used of the chemical relaxers, or?
Yes, in salons in particular, because in addition to like personal exposure, we're also concerned about exposure to salon workers, given that they're, providing these services on a daily basis. And so we'd like to find some information on the frequency in which they're actually providing these types of treatments.
Yes, I don't have any numbers specific to professional. I haven't done research in that area, but typically it's anywhere between 5 to 8 weeks for the chemical relaxers that someone would seek treatment for that. However, there is something that is growing within the natural community or within our audience is called the term of stretching. Like stretching the bandwidth of time in between the relaxers, when you're transitioning, or also if you do choose to use, chemical straighteners, so you're not using it as frequent. And within that stretching, you can see them going anywhere from like a span of 3 to 6 months, and there before they would, again, get a chemical treatment. And so that's something also that is growing as well for those that choose to straighten their hair, is that there's stretching or lengthening the time of in between of getting the chemical treatments.
Thank you. That's helpful. And Adana?
I don't have any concrete, scientific evidence from studies on this, but I echo what Dr. Williams said. It's like 5 to 8 weeks, typically between a chemical relaxer. Some people might want to have their treatments closer together for whatever reasons or stretched further apart. And I think it's a similar time frame for the keratin treatments, although it does seem like people get keratin treatments a little bit more spread apart time-wise.
Great, thank you. All right, let's move on.
Christine, just to that point
Yes.
that Adana just made, I'll just say that, we have very limited numbers, but it would show that it seems that that there's more frequent use of like a shorter amount of time between use of hair products, hair straighteners for Black and Latino women in our studies, and Asian women reporting longer time periods between use of the products. So I'm not sure if that corresponds to, the keratin treatments versus the other types of treatments. So.
Thanks, Robin. That's actually helpful. Does anybody else have anything they want to chime in before we move on to the next question?
Also, I would like to know, and Robin can speak to this, is that the Asian population, right? They do get, treatments, but their duration, right? It's like there was a table that was in our slide yesterday. The duration, between or the, how frequent they get them, on an annual basis among the Asian population is a longer amount of time too. It's not as frequent.
Right. We had at least 2 Black women, I think, who were saying they do it at least once or twice a month. They use hair relaxers, whereas Asian women, it tended to be much more like 1 to 2 times a year.
Right. Thank you. I did notice something, Robin, in one of the taking stock slides about the differences between ethnicities and, excuse me, use of hair straighteners. And I believe that one of the slides actually showed that Asian women were using straighteners more frequently than African American women, but I may have misinterpreted the slide.
It was Asian women use them, and we asked that as a way of like, do you currently or have you in the last year? So there's a higher prevalence of Asian women using chemical hair, we lumped it. It was perm, straighteners, or relaxers.
Okay.
There's a greater proportion of Asian women are using them either currently or within the last year compared to Black women, but the frequency, how many times a year it's higher among Black women than Asian women.
Thank you for the clarification. And I didn't realize that you had grouped perms in with the straightener. So that was great clarification. Thank you.
Yep.
All right. So let's talk a little bit about exposure. We know that some hairstylists use PPE, personal protective equipment, when they provide certain services, but we're not sure how regularly some of this personal protective equipment is actually used. And we're curious to know if any of you have any data on that. We know there may be some requirements, but there's a difference between actual, requirements and actual use. So let's start with Dr. Yanos.
I actually don't have data on this.
Okay, that's okay. Let's move on to Robin. Nope.
I don't, but I will say again, Leslie, I think in her slides yesterday had at least something, had referenced mask use. So she may have some data.
Yeah. And she did. And mask use is definitely more frequently used, obviously, since the pandemic. So it'd also be interesting to know what some of the trend changes have been pre-pandemic and, I guess during pandemic. Astra, do you have any of this type of information on frequency of PPE use?
We don't have the data, or we don't have that readily available. However, we do work with them, and we have witnessed a higher request for these PPE equipment that we do offer or provide to them from our organization. So that has risen in the request for these types of protective in terms of masks, face shields, even sanitizing, products that we were able to provide for them.
Great. Thank you, Astrid. And David?
I don't know specific information on PPE use, but I would think it'd be relevant to also consider air exchange rate in any situations where these are used, especially because we're talking a lot about VOCs and airborne exposure.
Thank you, David. And you actually sort of, and we're going to get to Paula, but you actually prompted another sub question under this is frequency of proper ventilation in salons, and what are some of the options that folks are using? Do you want to address that before we move on to Paula?
I don't have any specific details on what salons are currently doing or any trends in salons for that matter.
All right, no problem. Paula?
I don't have any data for PPE use in hair salons. I'm more familiar with nail salons, and I know that it's very common in nail salons to use a surgical mask, just like a face covering, which can give a false sense of security that the workers are protected against inhalation risk. And so that's why I was very curious to know what types of face masks were used in the study presented yesterday, but I don't have a data on that.
Thank you. And I'm not going to call people out, but of the panelists, do any of you have any information on frequency of ventilation use and types that are being used in salons, hair salons, or multi-use salons? I'll wait for your hands to raise, and if I don't see any, we'll move on to the next question. Armin.
I just wanted to also follow up on that and list some examples of exhaust ventilation systems that are commonly used, sometimes process enclosures, corrosion-resistant exhaust ventilation systems that are separate from other ones that directly exhaust to the outdoor environment. So if any of the panelists or anyone in the audience has any information, we'd be happy to take those up through our comment period.
Thank you, Armin. And we did get a comment from Dr. Dede Tate. She provided a reference for us called Salon Safety, Community Engaged Approaches to Workplace Safety Interventions by Dr. Tian, I can't pronounce the name, I'm so sorry, Adewumi Gun. And I know I slaughtered their name and I apologize for that, but thank you, Dr. Tate, for the reference. We appreciate it. So the next question I want to ask is about exposure studies, both the type of analytical study that Dr. Dodson's team ran, as well as Dr. Quiros Acala's exposure study in salons, or the type of data that we need to, adequately evaluate exposure. Are there other studies of that type, especially in salons or at home for that matter, regarding hair straightening products or other hair products that any of the panelists recommend we look into? And you could either let us know verbally, you could type them into the chat, or you could just answer verbally and send them to us later. I don't want you to have to feel like you have to dig them out right now. So let's start with Dr. Yanos.
I don't have any data on that.
Okay, thank you. And Dr. Williams?
No.
Okay. And Dr. Andrews?
Not specific to this, but and possibly relevant are all of the FDA adverse event reports that have been received. And I know we've submitted FOIAs to the federal government, both, I think, covering the last 4 years as well as in 2011, that covered the few years before that. And I'm happy to forward that information to SAP, at least covering those reports that have been submitted to through, I believe it's Medline, the federal government adverse event reporting database.
Great, thank you. And Dr. Johnson?
I don't have any other references right now.
Okay. And Dr. Dodson.
I don't have any references. I would just say that Leslie yesterday said sure it was the first of a kind study that she did, and I do agree with that, knowing the literature generally in the U.S. I will say it's hard. That's a hard study to do, anyways, right? Especially with at-home analysis. We will have data on biomonitoring levels in women and their specific product use, including hair product use. But how would we ever disentangle that necessarily from all the other products that women are using? So again, this is kind of like a cumulative exposure issue. It's just difficult. So yeah, you either need case reports or you need salon specific data to support that. So it's difficult to do, but I'm not aware of any kind of comprehensive study.
Great, thank you. And then we have a comment that came in from Jennifer Ortega. It says, I have not gone through the survey to see if the survey contains information on hair relaxers, but We Act is doing a survey so their results will come out at some point, and then they provided us a link. Thank you, Jennifer. I appreciate that. All right, well, we've run out of discussion time on this topic, but we would like to turn it back. So I'd like to turn it back to Michelle so we can see if there's any questions or comments from those who are attending online.
Thank you so much, Christine. And again, thank you so much to all of our panelists. Thank you for the comments that are coming in the Q&A. At this time, it is your turn, attendees, to actively participate with us. So if you have any follow-up questions or comments or information you'd like to share, again, the Q&A is available if you'd like to type and share the information there. You can also raise your hand. Don't worry, we don't bite. Feel free, talk to us. We want to hear from you. We did have some of those exchanges yesterday. And again, if you are joining us by telephone, just press *9 and you will be placed in the queue. I will call your last 3 digits of the phone number and press *6 to unmute. And you too can join and participate with us. So your questions can be directed to any member of the panel or to all members of the panel. And we do ask that you share both your name and affiliation. And just for some of your reference, the questions that our moderator, Christine, had gone over, a few of those were, what are the current trends for hair straightener use? How frequently are certain hair straightening treatments provided in salons? I believe we also discussed which safety practices are being used. If there's any evidence that exists regarding children or adolescent risk in adverse health effects compared to adults. So if there's some of these we didn't get to, these are a few others that we can take under consideration at this time. And panelists, you too, feel free. If there's additional discussion you'd like to add at this point. And then lastly, are there factors that have changed hair relaxing or straightening use in California and or nationally? So those are some questions again for consideration. And we're going to pause. I do recall from our last session, it does take some time to type into the Q&A. So I certainly want to make sure that we get your participation. And while we wait for that, I want to also make sure, and many thanks to everyone working behind the scenes here, that we haven't received any comments or questions through our Safer Consumer email as well. We do want to include all of your input. And today won't be the last day that you'll be able to provide input. We'll go over some additional information on how you can continue to work with us. This comment period is going to be open until July 9th. And later on today, I'll share some information on how you can make sure to continue submitting comments on that background document, which also has some additional questions in there as well as we continue this work.
Michelle Astrid would like to provide a comment.
Certainly. Dr. Williams?
Just adding to the last question, I believe, or are there any factors or changes here in the state of California or nationally that has led to more of or affected hair straightening or chemical treatments? And just the Crown Act, which I'm sure most of us know here on the call, it's recently passed in California and 10 other states nationwide. And so I think that is definitely a movement in a great direction to being more inclusive of natural hairstyles without the backlash of discrimination. So individuals are more at ease and more comfortable in wearing their hair in their more natural state versus having to chemically process it. So that's a good one to add as well.
Thank you so much, Dr. Williams. Okay, and as we have these additional moments for discussion, I know we talked briefly about PPE. I think that's a very common term to everybody now, right? Due to COVID-19. They did talk about PPE regularly. And I know when we do that, we talk about safe practices a lot in salons. Just from my personal perspective also, in terms of home care use, right? Home care use and PPE, you're not going to see individuals at home perhaps wearing face coverings. What you will see are the gloves typically. But if there's any additional discussion there as well in terms of any additional preventative measures people may want to take while they're at home doing at-home care. And that's to our panelists as well. And from a layman's perspective, I would assume things like ventilation, right? So if it's not that bathroom that doesn't have a window may not be the best place to do your application. Perhaps it's going into the kitchen area where you have a larger space for circulation, et cetera. But I just wanted to kind of entertain that for some of those who are joining us that don't have a scientific background for today.
But you are correct, Michelle. If you're doing any kind of at-home hair straightening, especially with some of the permanent straighteners, it's always mindful to use gloves, have some good ventilation. If you don't have maybe airflow through your house, certainly have the windows open, potentially with a fan blowing. The surgical masks only, they don't necessarily provide much protection. In fact, very little against volatile organic compounds. And I think there's a misconception about that. The N95 masks will provide some greater protection against volatile organic compounds versus the surgical masks.
I also see we have a hand raised by Jennifer Ortega.
Thank you, Armin.
Thank you.
I went ahead and unmuted you, Jennifer, if you'd like to chime in on the discussion.
Yes, can you hear me?
Yes.
Sorry, I didn't realize my hand was raised, but I was in the middle of typing a question, so I'll just ask that. I was wondering if in any of the research that has been mentioned so far today, the question about whether all components of at-home relaxer kits are used, because I'm wondering if people have their tried and true products that they use in terms of like neutralizers or shampoos that they use instead of the ones provided in the kits, because those individual products might also be good to look into depending on individual preferences. Because I know sometimes with hair dye kits, there's like shampoo and conditioner and those get discarded and like me individually, but I'm wondering if similar practices are used for at-home relaxer kits as well.
That's a great question. Thank you so much, Jennifer. And for our panelists, also Christine, if there's anyone that would like to address that as well.
At least with safer consumer products, we don't have that kind of information, and that's the kind of information we would love to know.
Yeah, I think that's an excellent point, Jennifer. We don't have that information, although I think that's something that we could probably engage with some of our community members to try to understand that a little bit more. I think it's a really important point to think about how, and we see this with other products as well, how people don't always follow the product as described or as recommended on the box, basically. And I think that that's always something to consider when you have manufacturers of the products who will say, if you know, it's safe if used as intended, but that we need to be realistic and thinking about other ways in which people actually use the products. Either they use them more frequently or they use them in different ways or combine different products generally. And so I think it's an excellent point to try to actually collect some kind of community-based data on how people actually use these kits, if they throw away components, if they add components and things like that, because I think that that could drastically kind of change what you would estimate as an exposure to several of these chemicals if we're not really realistic about how they're used.
Thank you so much, Dr. Dodson. And again, thank you, Jennifer. Excellent question. At this time, it doesn't appear as though we have any additional questions from our attendees. I'm just double checking. I know when I say that, I tend to get another question in the Q&A. So I'm going to look at that Q&A one more time. Okay, great. We are scheduled for one more panel discussion this afternoon. And we want to start that discussion at approximately 12. We're a little ahead of schedule by about 4 minutes. So we're going to take a slight break. We had planned on a 5-minute break, but we are going to go ahead and reconvene at our scheduled time, which will have us start our next panel discussion at 12 o'clock. So actually 12:05 was the time to start, but let's come back. And we may break a little earlier. You'll have a lot more time at the end of the day to have conversation, and we'll come back at 12:05, everyone, 12:05. We'll start timely. Hello, everyone. I want to welcome you back with us. It is now 12:05. Again, welcome back. Our panelists will start coming on screen very shortly. And once they do, we will start to engage in a moment. I do see that our moderator for this session, this is panel number 4. This will be our last panel of the day. We again want to thank Armin, who handled our last panel session. And all of our panelists. Oh, and maybe I have that there in reverse. I apologize. But we want to thank them for panel 3. And now I do want to introduce Christine Papagni. She did have some clarification during the last panel before we move on very quickly. I'm sorry, Christine?
Yes, thank you, Michelle. I wanted to say when we were talking about personal protective equipment, I unintentionally misspoke. I meant to say that N95 masks provide some protection against particulate matter, not VOCs. And so I wanted to correct that. And thank you for the staff person who let me know that I misspoke, because I do know that, but I didn't. That's what happens sometimes when you're answering these questions live. So apologies for misspeaking. N95 masks provide some protection against particulate matter, not against volatile organic compounds.
And thank you, Christine. And I want to thank the panel again. That was an extra question I kind of threw in there. And that's from personal experience. So on, being safe at home is something we certainly want to be able to do. And that's for all who are participating with us as well. So thank you again to the panel and to Christine for that. So we are now going to dive in to our panel number 4. And that is prioritization and evaluation of hair straightening and personal care products. And I am going to turn it over now to Armin Etemad. He is going to be hosting for our last, as moderator, panel discussion. Armin?
Thank you so much, Michelle. Our fourth and final topic for today will conclude with a discussion about how SEP and our personal care products team in particular can best prioritize and evaluate hair straightening products going forward. I'd like to again remind everyone that we are concluding our preliminary screening process, which is denoted by the far left box within the arrow figure on the left side of your screen, with deliverables such as publishing our background document and hosting this exploratory workshop. As we begin to move towards the next phase and continue to refine our research and develop a much more thorough scientific profile among the other activities in the middle portion of the figure that's denoted with a circle, we will consider a multitude of program priorities and a multitude of factors, some of which were touched on previously by our CPET supervisor, Andre, who addressed an audience question during discussion number 2. These include several important factors, such as protecting environmental justice communities, protecting sensitive subpopulations, and evaluating product risk and life cycle assessment. That's just to name a few. As such, it's really important, and we would like to receive feedback and also give the opportunity right now to every panel member to respond to 2 key questions when it comes to prioritization. With so much here for us to consider, I'd like to ask, first, which hair straightening products should our program evaluate as higher priority? And second, in addition to hair straightening products, are there other personal care products or other chemicals, even from different categories, that you'd like to bring to our attention that should be evaluated and prioritized? And with that, I'd like to turn to our panel, and let's start with Dr. Yanos.
I think, actually, I honestly don't know which products should be prioritized aside from what we've discussed very early on, focusing on the relaxers and the keratin treatments with the formaldehyde based or formaldehyde releasing products. So I'll defer to other panelists.
Thank you, Dr. Yanos. And we'll have an opportunity to return again if other products come to mind or other ones are mentioned. Dr. Williams, do you have any other product categories that you'd like to bring to our attention that we should prioritize?
I think our discussion definitely is a great start. It was mentioned in the discussion yesterday about hair weaves, or different types of artificial hair that we may apply to our hair. So that can be inclusive. I don't think we've touched on much, or there's a lot of research centered around that. And then also the hair glues for application as well. That can, be very, toxic. So those are some other things to think about.
Thank you, Dr. Williams. Dr. Andrews.
So generally, I think these are all important product categories to look at in terms of prioritization, and I see significant value in looking at all of them. I do think that children's or hair relaxers marketed to children and children's products kits are a place of particular importance, especially based on the number of studies that have been discussed both today and yesterday in terms of potential health implications for Black women as standing out, especially because this is one of the, I think it's unique, at least among the hair straighteners, in being marketed directly towards children as standing out. But generally, I think this broad focus on products that are changing the structure of hair and ensuring that the entire product category and those product kits are looked at in their entirety stand out as really important pieces to focus on, especially lining up with the documented and increasingly documented health harms from those product category uses.
Absolutely. I think there's tremendous overlap here with a discussion we've had previously on definitions and ensuring that we're inclusive as possible as we continue to move forward. Thank you. Dr. Dodson, would you like to chime in as well?
Sure. Dr. Andrews just mentioned, I would suggest focusing a lot on children's use of these products or even peri-puberty use, so adolescents. I think thinking about these, especially given the chemicals of concern that we already know are in these products, thinking about different critical windows of susceptibility. So that's not only children, it's also reproductive age women who are applying these, these products are being applied to themselves, or they are salon workers, where salon workers may be applying these while they are pregnant. So those are the two kind of more vulnerable groups that I would focus on in use of these particular hair straighteners. In terms of the other products that you might want to consider related to hair products that you might want to consider, Dr. Williams brought this up, is hair glues. We have kind of, it's somewhat anecdotally, but hearing somewhat from our community members about use of hair glues. We know that they are being used. We also know that they're sometimes hair glues are being used for eyelashes. And so thinking about that potential exposure and also, and this has been brought up, I think, yesterday, but those products, as we move away from women tending to straightening their hair, but moving more towards natural hairstyles, I think we need to pay attention to those products that are used to maintain natural hairstyles. So what we call them natural, right? It's basically meaning kind of not straightened chemically. And so, and the reason to be concerned there potentially is that we know that some of those products can contain chemicals of concern, and that they tend to be used more frequently than any of the hair straighteners, and are left on the hair and probably used in combination. So you can have kind of aggregate exposures to these chemicals across multiple products that women are using more frequently and regularly.
Thank you, Dr. Dodson. Definitely subsensitive populations, children, adolescents is something that we hope to gain more information on from these workshops and comment periods. And as well, hair glues is something particularly new for us that we hope to look into as well. Christine, would you like to chime in as well to the discussion?
Yes, please. I had a follow-up for Dr. Dotson. In your study, the Helm et al. Study, there was a variety of hair products you looked at and measured the chemicals within them. I know you looked at some root stimulators and some lotions and some other hair products. Were there some that had chemicals, like higher concentrations of chemicals, or chemicals that maybe had more hazard traits?
Yeah, I mean, I guess, we tried to look at kind of were there patterns that we saw? I mean, remember, we only looked at 18 products total, 3 of which were relaxer kits. But we did see, for example, like the cyclosaloxanes were used in anti-frizz. We separated those out. So in anti-frizz products, and that's where we saw cyclosaloxanes at like 46% by weight in one of those products. So that's a concern in terms of cumulative exposure to cyclosaloxanes. Parabens tended to be more commonly found in more of the lotions, the hair lotions. And so I guess it kind of depends on which chemical you're most concerned about, and then the product type. Keeping in mind, right, that maybe an anti-frizz or hair lotion is used much more frequently than maybe some of the other products, like a relaxer.
Thank you. And I actually have another follow-up question. I know we still need to get to Dr. Johnson, but this question is for all of the panel members. And you brought up the cyclosaloxanes and parabens, and of the chemicals that we evaluated, are there any that you think should be prioritized maybe over others? Because we looked at 5 different chemicals in 3 different classes.
One thing I will say is that I think that depending on the endpoint that you're interested in, you have to consider that many of those chemicals have similar endpoints. So several of them act like estrogen or estrogen mimics. And so you wouldn't want to necessarily think of one of them at a time or rank, I'm going to only consider parabens and not benzophenone 3, for example. So because we know that those can kind of act together. I would say that, again, it's the endpoint of concern. I will say that, from the presence of formaldehyde, I mean, the endocrine disruptors are very important. But I would say, the exposure to formaldehyde is particularly concerning. And also chemicals that have been brought up, the 1-bromopropane that I brought up earlier that Dr. Kirasakala had found in the salon, as well as I think Paula might have brought up ethylene oxide. That would be really concerning if that is a potential chemical that are in these products.
Thank you, Christine. Thank you, Dr. Dotson. That's an excellent segue. Dr. Johnson, if you'd like to chime in on ethylene oxide or other chemicals of concern that you'd like to bring to our attention.
Yeah, right. I did bring up ethylene oxide and 1,4-dioxane as contaminants that have been put into our program. Also, formaldehyde is obviously very hazardous. It's a known human carcinogen, but it's going to be banned in California in use in cosmetics in 2025. So I don't know if, how that falls, how that affects your potential regulations. But we've talked about also formaldehyde releasers. I think more research could go into that and how, what levels of formaldehyde are actually present in products that contain formaldehyde releasers. And then as far as part of our project, the Capable project, we reviewed labels of 545 different products, and we found that 65% of the products contained carcinogens or suspected endocrine disruptors. So that's a pretty large percentage, and 74% of the products of the labels we reviewed contained undisclosed fragrance chemicals, and it was 93% just looking at products used by Black women. And so these are chemicals that we're not able to identify because they're not disclosed on labels. But other chemicals that we could identify, the most common chemicals of concern in hair products in general, not only straighteners, but just all the hair products that we looked at, were the most common chemicals were cyclosaloxanes, parabens, and formaldehyde releasers. We also found other potential carcinogens, butylated hydroxyanosole, BHA, cocamide DEA, and selenium sulfide. Selenium sulfide less commonly. And then other potential endocrine disruptors, not only parabens and cyclosaloxanes, but also oxybenzone, avobenzone, butylated hydroxytoluene, Lilial, resorcinol, and galaxolide. So those are just in the hair products that we evaluated. And then I also wanted to mention, just because it's one of the chemicals that's reported most often into our database is retinol, or retinol palmitate. Those are synonyms for vitamin A, essentially. And the concern is that when you apply, when you have retinol on your skin in skincare products, and then exposure to the sun, there's a concern about sun damage and skin cancer. And I'm just bringing that up because we have so many products in our database that have been reported with retinol. And we have, out of those products, some of them are nighttime products or acne treatments, but there's 990 products in our database that are likely leave-on products that might be left on the skin and potentially then exposed to the sun. So I just wanted to mention that also for potential future investigations for that too. And that's all.
Thank you so much, Dr. Johnson, for the extensive review of chemicals and not only hair products, but other personal care products that we could consider. Before moving on to the next sub-question, I'd like to open up the floor to anyone else in the panel that would like to chime in on anything that was discussed after their first opportunity. I see a hand raised from someone from SCP, Michael Ernst, who is also a hazardous substances engineer. So I'll turn it over to you first, Michael.
Oh, that's not the right camera, but I'll shift. Thank you, Armin. My question is related to our discussion that we just had. One of the things as a researcher and engineer with ASCP, and I think it's one of our goals of our program, is to try to focus our resources in areas where we could actually make a difference. We like to use the term often, like, how can we move the needle? And and I think it was Dr. Dodson that mentioned, if we decide to prioritize a specific chemical or a product, it's not because necessarily that we don't think that the other chemicals or the other products are less important or they don't matter. It may be because we just feel like we can make a difference in this area, either more quickly or more effectively. And so I wanted to pose this question to the panel on that, kind of in that framework where that we're all concerned about health impacts for these of these chemicals and from these products. What's something big or small that you would like our program to see specific in this area to make a difference, move us forward, even if it is just incrementally safer to get us to the ultimate goal of, allowing people to use whatever products they want and not have to worry about potential health impacts?
Thank you, Michael, for the wonderful question posed to the panel. Does anyone want to take the opportunity to provide one or two things that they think can help us achieve the goal that Michael mentioned?
One thing that I've been curious about it, and maybe this is, maybe I, not being a California resident, I'm not quite sure about the whose regulatory purview this is. But one thing I've heard, especially about hair straighteners before, is that it may actually be like a chemistry problem, that it's like the innovation is not around kind of, well, why aren't we just using this less toxic chemicals? That there may not be a chemical that has been developed. I don't know, like, is there a green, I guess maybe I'm trying to say is there a green chemistry solution to this? That investment in the safer alternative it's a very specific performance or functionality of this product. And I don't know, is there an alternative to some of these more caustic chemicals, just simply because of the performance and functionality of what it needs to do, break the hair strand, or the hair bond.
Michael, would you like to clarify your question or add any supporting follow-up question?
I was just going to add that, and I see Andre also raised his hand. As we've seen from our graphic, we do have a very involved 4-step process. And so, for example, and once again, we are in very early, just starting preliminary stages, but like one potential scenario is if we prioritize, say, a product, a hair straightener with a certain chemical, and then it goes into the alternatives analysis phase. And during the alternatives analysis phase, the manufacturers say, there is no functional alternative. There is no alternative here that can meet these performance requirements. Our final step in our process is our regulatory response. And as part of that regulatory response, when someone basically there's a pathway, when there's no functional alternative, one of the regulatory responses is to require the manufacturers and other responsible entities to fund green chemistry and green engineering to help develop or move us closer to a safer alternative. That's, what, understandably, these are large issues, and they all can't be solved, overnight. But once again, I thank you very much for your answer, because that's the type of information that we're looking for to what direction, directions, how can we move the needle? What are the issues? There's no functional alternatives. Well, then we have to focus on promoting and encouraging innovation, as opposed to getting people to adopt already existing safer alternatives. That type of thing.
Thank you, Michael. Andre, I see you'd like to join in on the conversation as well.
Yeah, thank you. I mean, I more or less wanted to say what Michael was just said. We do have, our framework doesn't presume that there necessarily is a safer alternative that's a chemical. There could be alternatives that are non-chemical, or if there really isn't a safer alternative, we might sort of expedite the alternatives analysis process, do the abridged process, and go straight to regulatory response. And for whatever specific product chemical combination we ended up regulating, there's a range of regulatory response options available to us, and they really do depend on the specifics of the hazard and the exposure potential for the particular product, the hazard of the chemical and the exposure potential. So it could be, as Michael mentioned, green chemistry and engineering funding. It could be restrictions maybe on the levels of the chemical, or it could be something else, engineered safety measures, or even potentially a ban. Sorry, I just got a note from Michelle that my camera was off. So we do have a number of options available in a scenario where there really isn't a safer alternative. Like if you really just need something caustic to actually do the job of the product, there just may not be an alternative to meet all the requirements of that product. So then we might be kind of going to the next step potentially more quickly.
Thank you, Andre. Dr. Andrews?
Sure, thank you. I just had one comment in terms of, I think the ultimate goal for SCP and at least from our side is ultimately reducing risk and as much as possible. But another piece of that is also directly raising awareness and documenting the risks. And so I think there is significant value in the process in terms of both the alternatives analysis and clearly documenting the risks and hazards to both consumers and salon workers from some of these specific products and product types. And ultimately, if in some cases there are trade-offs in terms of functionality and hazard, I think clearly documenting what those are in a way that's understandable by consumers and salon workers is incredibly valuable. And that before you get to the possible management restrictions on marketplace. So I just want to reiterate the value in that process and clearly documenting those hazards and the alternatives.
Thank you, Dr. Andrews. That'd especially be helpful as we are moving along our process to be cognizant of that. So we discussed a lot of different prioritizations and different categories of such. There's one that we didn't touch on as much that I'd like to bring to the panel's attention, and that's protecting environmental justice communities. I'd like to just simply ask, what would that entail? Are there specific activities or specific points of emphasis that they'd like to highlight as we continue to craft our narrative in this project? Dr. Dotson.
Maybe Astrid's going to touch on this, but I think part of the key here, especially is trying to protect environmental justice communities, actually making them part of the conversation and supporting and funding community engaged research and communication efforts. Right. So kind of going towards if maybe there is an alternative. So what we can do is document and share and educate. I think the only way that's ever going to be effective is if you actually engage communities in that education community communication efforts. So I think, whatever you can do to bring community to the table and support the community and listen to the community on how to share this information is going to be key.
And
Thank you, Dr. Dodson. Yeah, sorry, go ahead, Dr. Williams.
Yes, so I'll just follow up. All of those were great points to mention as being inclusive of the audience that you're targeting, but with that, the marketing to these audience. And so, as we mentioned yesterday, the chemical relaxers and, products, how they're targeted within the, Black and African American communities, like the Just For Me hair relaxer kits, for the youth and, for this, our individuals. And so when you have products that are potentially, toxic or, harmful, and how there is racial injustice there when you're, targeting, mass communities and particularly communities of color.
Thank you so much, Dr. Williams. I really appreciated yours and Dr. Dodson's perspectives on environmental justice and avenues that we could take to move forward and engage with these communities. And as well, Dr. Andrews, your examples of risk assessment. And I'd also like to encourage the rest of the panel, if there's anyone else that has any specific examples or specific ways we could document and approach these methods of prioritization. The floor is open. Please feel free to chime in.
I'll chime in here. So I think in addition to, reaching the communities, that are largely affected. I think one group that needs to have a voice in this includes the hairstylists and salon owners, because maybe they are, looking and noticing certain trends and certain products that are widely used. So that could be one way to prioritize certain chemicals and or certain brands of products, for instance. I can just mention that, I'm based in New Jersey, and so certain hairstyles and chemical treatments might be different here on the East Coast than what's being used locally in California. So I do think that reaching the stylists and salon owners and individuals providing these services could be one starting point. I know that doesn't address the issue of products that women or men, just populations are using at home, but I think, to get a sense of things that might need to be prioritized, you could start with the salon owners and stylists.
Thank you, Dr. Yanos. That's a wonderful perspective as well, especially the region-based approach. Oftentimes, even though we do live in a diverse community, we are much closer connected than we think, and do borrow trends and styles from one another, even across the United States and between different regions. So is there any last questions or last comments from the panelists? I do see we have a hand raised in our audience, and we will get to you very shortly. But before we do that, I'd like to give one last opportunity if anyone else would like to chime in on the discussion of prioritization. If not, I'd like to thank once again all the panelists for their wonderful contributions today. I personally genuinely enjoyed assisting Christine in moderating these discussions, and now look to field questions and comments from the audience and pass this discussion on to our facilitator, Michelle Banks-Ordon.
Thank you so much, Armin. And again, thank you so much to each and every last one of you, our panelists. I do see here a note from our chemical and product evaluation team supervisor, Andrea Algazi. I want to make sure I'm getting this right. I hope I'm not being repetitive. And it indicates that one of our regulatory response options is to require manufacturers to provide information to consumers to prevent or limit exposure. So if that was repetitive, indeed, it's okay because it is important information, but I definitely want to make sure to share that as well. As Armin indicated, it is now your opportunity. For those of you who have joined us online, also, if you have joined us by telephone, please, this is a great time for this panel discussion, the questions that were asked. If you have additional questions and or information you would like to add to the conversation, and I do want to reiterate a couple. Oh, and before I do that, we do have an item that has just come into our Q&A, and it is from Jennifer Ortega. Thank you so much, Jennifer. And her question indicates, I think it is also good to include youth in environmental justice communities to see how influencers and social media and the YouTube beauty community is affecting certain trends and products being used or advertised. Since Dr. Dotson mentioned adolescents is an important audience regarding critical windows of exposure. Excellent comment, Jennifer. Does anyone on the panel want to expand or expound on that? Thank you. And thank you again, Jennifer. Absolutely excellent comment. I do see a hand from one of our panelists, and that is Dr. Williams. Dr. Williams.
Yes, I just think that, thank you, Jennifer, for bringing that up, because that particular population definitely is influenced heavily by social media and the platforms such as YouTube, where you can go on there and find a plethora of videos in terms of hair care, right? And so getting the information out to them in the format that is, well received is something that we should use in our intervention strategies or in their education and outreach. And so definitely being mindful of how we can engage with that specific audience or just our target audiences in general.
Thank you, Dr. Williams.
Just quickly, Jennifer, I did notice you had a hand raised when I deferred audience questions, so please don't feel limited to text questions or comments. If you'd like, you can raise your hand and we will unmute you so you can speak with the panelists.
Thank you, Jennifer. And we have another panelist that would like to share. So Christine.
Sure. One of our staff actually provided a comment, Dr. Michelle Romero-Fishback, and she wanted it brought up that it's also a good idea to include youth and environmental justice communities to see how their influences in social media and YouTube beauty community is affecting certain trends and products being used or advertised. And she mentioned that Dr. Dodson mentioned adolescence is an important audience regarding critical windows of exposure.
Thank you, Christine. And I believe that question is very similar. And so that is certainly an area of interest. I also see that Michelle has raised her hand. So Michelle, if you could go ahead and join us. Good to see you again.
Hi. Well, thank you for letting me speak. What I was trying to do, I was just trying to express my support to the opinions that were brought up, the question and the comment by Jennifer Ortega as well, and by Dr. Robert Dodson about involving the community. I wanna express our agreement. I believe within our program, we are already starting to work on initiatives to be more proactive in terms of involving the community. And this definitely is not falling under empty or ears. We are definitely listening. And thank you so much for sharing that with us.
Thank you so much, Michelle. Are there other questions? And again, please feel free to raise your hand. And if you are joining us on the phone, press *9 to join us as well.
Or if you'd like to provide any comments or feedback about any of the questions that we talked about today, or your recommendations on prioritizing chemicals in hair straightening products or other products.
Yes. And I do want to reiterate for the audience, one of the questions that Armin posed in this last panel, he said, in addition to hair straightening products, are there other personal care products or chemicals we should consider evaluating and prioritizing? And we did hear from our panel everything from the weaves and the glues that are utilized to add those. And I just want to get clarification also from Armin and Christine for our audience out there. It says personal care products, and we're not limiting that to hair when we're asking for those suggestions, are we? I just want you to make that very clear for those out there if there's some other items.
Right. And today's workshop is specific to hair straightening products, but we are evaluating other personal care products within our program. So that's why we would like to hear that feedback as well.
Thank you, Christine. And I see here we have a hand raised, Dr. Yanos.
So yes, in relation to the last point, since this workshop was focused on hair straightening products, I guess if I could suggest hair dyes as well, because I did mention that many people, that are using chemical relaxers are also using hair dyes. So maybe that could be another class of hair product that could be prioritized.
Thank you so much, Dr. Yanos. And we're just going to give it a few more moments. Again, I know typing in the Q&A does take a moment. And we do have another question. And that question is from Jennifer Ortega. A product I would suggest are setting sprays after makeup application, because those are products used that are sprayed on the face and inhaled. They are meant to make makeup last longer. So the ingredients that have that function might or may not be bad. Thank you so much, Jennifer. Love your engagement and active participation. Thank you. Okay. So we don't have any additional questions at this time that I see, and I will continue to monitor the Q&A. But what we are going to do, I want to make sure that we share with all of you, this is just the beginning. This is just the beginning. So first to Dr. Adana Yanos, Dr. Astrid Williams, Dr. David Andrews, Dr. Robin Dodson, and Dr. Paula Johnson. Thank you so much for the whole morning, for being with us, staying with us, engaging in this conversation. It is a critical conversation. Thank you to all of our guests who have joined us as well online, and to our amazing moderators, Christine and Armin, excellent job. For those of you who are out there joining us, if we could go to the next screen. Next slide, please. This is only the beginning. And what we mean by that, this is our initial analysis. We will be coming back to you. There's more work to be done. You'll be hearing from us, and we want to hear from you. And to do that, we are in a public comment period. As we've indicated, we do have a background document and other information available for you to view online. We started this on May 24th with information. Those comments, those documents, we're going to receive those up till July the 9th. Again, that's July the 9th. And you can submit your comments to CalSafer. And for those of you who are joining us online, that information is now being put in the chat. So you can simply use that link. For those of you joining us by telephone, again, that's calsafer.dtsc.ca.gov. /CMS/comment package. And we do have some other items there, but if you go to CalSafer, DTSC, or Google it, scroll down to comment period, you will find this information. In addition to that, next slide, please. There are 4 themes of questions, essentially, that we're asking to stakeholders. Background document also does include some more, but these are the themes specific to that background document we want to encourage you to look at. And that is chemicals in hair straightening products. Theme number 2, exposure to chemicals from hair straightening products. Theme 3, toxicity of chemicals in hair straightening products. And then the 4th theme is the market presence. Next slide, please. We also ask that you join our email list so that you can continue to get updates as we continue this conversation. To do that, you can go to bit.ly/SCP updates. Again, that's bit.ly/SCP updates, bit.ly/SCP SCP for Safer Consumer Products updates. Very simple. If you have general questions, again, use that email address, saferconsumerproducts@dtsc.ca.gov. And if you are a member of the media that has joined us today, or you have questions and you're from the media, we have in our Office of Communications a public information officer specifically assigned to this project. His name is Sanford Nax, and you can reach him at sanford.nax@dtsc.ca.gov. Again, that's Sanford, SANFORD .nax, N-A-X, @dtsc.ca.gov. If you have technical questions, Christine.Papagni @dtsc.ca.gov. And again, you've heard from Christine as a moderator today. She is our project manager on this assignment. If you have any technical questions, she is certainly the resource to go to. You also heard from our chemical and product evaluation team supervisor. You heard me refer to that as CPET. So again, our chemical and product evaluation team supervisor, that is Mr. Andre Algazi at dtsc.ca.gov. And to reach him again, that's Andre.Algazi at dtsc.ca.gov. So if you have meeting requests, and you'd like for us to speak with your organization and or work with Mr. Algazi or hands-on with Christine Papagni, there are some interviews you may want to have with us. We had some earlier. Please contact him for those purposes. And at this time, to close out the workshop for both days, I would like to introduce DTSC's very own Deputy Director of Safer Consumer Products Program, and that is Mr. Carl Palmer. Carl?
Thank you, Michelle. Thank you, everyone, for being here today. I particularly want to thank our panelists today for the generosity of their time and wisdom. We learned a lot from you today, from your input, from your questions, and we'll be looking forward to working with you down the road as well. Also, I want to thank all of the presenters from yesterday and everyone who's been involved in this, not just as a presenter, but as all of you out there who are watching and listening. As Michelle said, we are just beginning this process. We need your input. Most of the presentations and panelists today have been, and yesterday are from academics and advocacy and government folks. We know we've had various folks watching and participating from industry. We need you to step up and engage with us too, because that information that you have is important to us as well, because what we need is the best information we can get to make good decisions about how we can move this process forward to accommodate everyone's interests and, as Michael said earlier, move the needle in the right direction. So that's my plea for everyone to stay engaged. We are beginning, but there's plenty of opportunities for engagement. You can comment on our background document, you can send us emails, you can meet with us. The door is wide open, so I'm thanking you ahead of time. Also, I really want to take a moment here to do a particular shout out to Michelle Banks-Ordone, our MC for the past 2 days, who has embraced our team and helped guide us through this process. And I also am very proud of our staff at DTSC, both in SCP on our team and all the support we get. There's a lot of people behind the scenes, people from our Office of Communications, our Office of Environmental Equity, our IT shop, and our Human and Ecological Risks Office, the HERO office, that all work together to move the needle and to try to do something that is meaningful and impactful. So I'm very grateful for all of them. And I'm grateful to all of you for participating. Again, we'll look forward to your input. Stay tuned. Please sign up for our listserv so that you can get the latest updates as what we're doing, the next steps, and our decision. So thanks again. Be well, be safe, be cool. It's 100 here today, but it may be cooler where you are. And thank you again for your participation. So with that, we'll end this workshop and we'll look forward to hearing from you. Thank you.